some time, but can I ask members, when you speak or ask a question, just to introduce yourself and the division you represent the first time you speak, and that can advance the getting to know you process. I'd like to welcome the members of the public and the press who are here in the far left corner, excuse me, but also who will be following this meeting on live stream through the County Council's website. And just a reminder to all of us that the Council supports filming, recording and taking of photographs during the course of this meeting, as long as there is no disruption to the proceedings. As you've discovered, we are meeting in the Cambridge Corn Exchange, and we're doing so for reasons of COVID and the advice we've been given about health. Members and officers were asked to have our face coverings on until the start of the meeting, but we now can remove them for the extent of the meeting while we're in our chairs. To the members of the public and the press who are present, can we ask you to keep your face masks on? In the traditional way, if you wish to speak at any point during the course of the meeting, please raise your hand, and our new Vice Chair, Susan van der Ven, on my left here, good morning to her, and myself will be taking a careful watch to make sure that we see everyone who does indicate that you wish to speak. Can you please turn off your mobile phones, or at least put them on vibrate? And I haven't done mine, so I'm going to do that now, which is a cue for anyone else who hasn't done that. In relation to fire preparations, there are no planned fire drills today. If you hear a fire alarm, go to one of the exits marked with the green exit sign there and there on the right, or there on the left, and the assembly point. I forgot to ask Rhiannon, the assembly point. Dan? The assembly point if there was a fire. Outside of the front door, that's where we would assemble. There are gentlemen's and ladies' toilets available. The ladies' toilets are through that middle door there to my left. The gentlemen's toilets are back through the door we came in on, and on the right-hand side as I'm sitting. There's a careful one-way system to access the toilets, which does mean going upstairs, so be ready to follow that. There is, of course, an accessible toilet for people with disabilities, which is straight ahead near the front door on the right-hand side. Those are, of course, the most important things that will all be said today, but having said them, the meeting can start, and the first item is the notification of the appointment of the Chair and Vice Chair, Rhiannon Leighton from Democratic Services.
Hi, so we've had the first item on the agenda is the notification of the Chair and Vice Chair. Councillor Howitt and Councillor Susan van der Ven were appointed by full Council on the 18th of May 2021 as Chair and Vice Chair of the Adults and Health Committee. Thank you. And just to let people know that in order to make their microphones work, they've got to click on and off on the button at the front, and the closer you are to the microphone, the louder you will be. Thank you.
Councillor Bowden.
Thank you very much. I'm Councillor Chris Bowden and I represent Whittlesea North. First of all, congratulations to both of you on your appointments. The previous Health Committee was extremely collegiate and quite informal, very much on first-name terms most of the time. How would you prefer, Chair, for this meeting to be conducted and future meetings? How should you be addressed, and how formal or informal would you wish us to be, please?
I think for this meeting I'm going to follow the standard practice for the other service committees, so we will call each other by councillor and full name, and of course the officers will do the same. But I take note of what you say. Let's review that as time goes on, and certainly in the informal discussions we all have, and you and I have already had. I'm very, very pleased to be called Richard, and I hope everyone will do that. But I think for the meeting proceedings itself, we'll stick to the standard practice, at least to go on with. Thank you. I also, although many of the members are new, we have one senior officer who's new, who's Jyoti Attri, our new Director of Public Health. It's her first meeting since her appointment. We're absolutely delighted to welcome her to the authority. And would you like to say a couple of words just to introduce yourself?
Sure, thank you. Hi, I'm Jo Teatry, new Director of Public Health for Peterborough and Cambridgeshire, and I too am delighted to be here. I was attracted to the two councils from the job pack, which demonstrated the two councils' commitment to addressing health inequalities, and I haven't been disappointed since I've been here. I think it's a great time to be joining, a time of renewal and change, and I'm sure with the support of my colleagues in the council and members, we're going to make some good progress on improving health outcomes for the two boroughs. Thank you.
Thank you. You're very welcome. We'll try not to disappoint you at any point, but I can't promise over the years that there won't be once or twice. But we'll try very, very hard not to. You're extremely welcome and great that you're on board. We now move to apologies for absence. Rhiannon.
So we've received apologies for absence from Councillor Kevin Reynolds and Councillor Mayreed Healy, who will be substituted by Councillor Sarah Bagent in the second half of the meeting.
And we've also received apologies from Councillor Garvey, who's one of our district councillor co-optees, who we've not yet co-opted, but when we do, she's sadly not feeling very well today, but possibly because the co-optees are going to join us only for the afternoon. She could join us, but we will formally record her apologies as well. Are there any other apologies that anyone knows about? No? Thank you. I now move to declarations of interest. Does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest in advance of today's business? There are none. The next item is co-option of district members. We've received the following appointments from district councils: Cambridge City, Councillor Mayreed Healy; Huntingdonshire, Councillor Sarah Wilson; East Cambridgeshire, Councillor Liz Every; South Cambridgeshire, Councillor Corinne Garvey; and Fenland, Councillor Sam Clark. The co-opted members will join us for the second half of the meeting when we consider the scrutiny items. Everyone happy with that? Thank you very much. I've got 3 people nodding now. I encourage others to join. We now move to item 4, minutes. And let's take the minutes of both the last Adults Committee and the last Health Committee. The last Adults Committee was 18th of March 2021. Are members happy to approve them as a correct record? Yes, thank you very much. And the last Health Committee was on the 11th of March 2021. Are members happy to approve them as a correct record? Yep, thank you. Item 5, petitions and public questions. We've received no petitions or public questions this time, and therefore I'll simply move on to the next item on the agenda. Item 6, and I think it is befitting that we start with it, given the fact it's had such a grave impact on all of us and all of the people we represent, is COVID, the impact of COVID-19 on residents and communities. The report is on pages 23 to 58 of your pack, and Val Thomas, Deputy Director of Public Health, will present the report. Thank you.
Thank you, Councillor Howard. It's been a very eventful year, perhaps is an understatement, and I think the data that's presented in the paper really pulls out our high moments and our periods of relative calm, but it's been a very challenging year for residents, for communities, and for everybody who's been working in the realm of COVID. And I think during this year, the important thing to say, I think we've been working very collaboratively as a system, and that's across organisations, but most importantly with communities and voluntary sector, who have played an extremely important part in managing this pandemic. I think that the data shows that we've had the surges back starting last spring, again in the autumn, and then lastly in January. Since January, we've seen numbers fall. We've seen the introduction of the vaccination programme. At the moment, we have certain risks. We are seeing perhaps our numbers creeping up again, and we know that's somewhat inevitable. I think probably everyone's aware of the variant, and we also just come out of stage 3 of the roadmap. To some degree, that's inevitable that we will see an increase, and I will come back to that. And I think the paper also includes the ongoing impact it's having on our health services, and I've just put some of the data that is available at the moment from our local NHS services, and that's obviously something that probably committee would want to look at again going forward. In terms of the longer health impacts, and I think Jyoti referred to improving the health of the population, COVID has certainly presented a lot of challenges to us. We don't fully understand the full extent of them at the moment, but we do know that for those who already experience health inequalities, these have been exacerbated by the pandemic. We know within that certain groups have been particularly affected, particularly economically deprived, but also our black and minority ethnic populations. We know that the economic impact will have an ongoing effect on health. Certainly in terms of, we are starting to see that not just in access to services, but in terms of numbers unemployed, particularly affecting our younger populations. In terms of how it's affected our services, we know that we haven't been able to deliver them in the way which we would like to deliver them, but I think the one positive thing is that we've learned new ways of delivering services, and we've learned to very much use technology, but we're also aware that that doesn't work for everyone. So we've developed very bespoke solutions. And I think probably Charlotte might like to talk in terms of how social care has adapted to the COVID requirements. I think probably the challenge is we are where we are. We know in terms of our health of our population, there are particular impacts which we need to address. Throughout the pandemic, we've been very much working with those groups most at risk. I myself chair one of the 5, in outbreak management terms, we have 5 cells, and those cells focus on certain groups. There's one around care homes, one around healthcare, one around education, and I lead the cell which deals with vulnerable groups. And throughout the pandemic, we've worked very closely with various groups, various minority ethnic groups, gypsy traveller communities, offenders. We know that these groups have particularly poor outcomes from COVID, and this work is ongoing at the moment, working with the organisations that serve these populations, ensuring that they get the right care, and particularly, there are particular groups that have found it very challenging in terms of employment, so that's an ongoing challenge for us. In terms of health services, I think there are other papers on the agenda in terms of our health and social care services, how we can work going forward with the integrated care system, but that's another paper later in the agenda. But I think there are opportunities there very much to address the challenges which COVID has presented to us. The immediate challenge, just going back to what I said just now, is that we are seeing our numbers nudging up. We are particularly concerned of numbers in Cambridge City, and we know that we've taken immediate steps in increasing our testing, increasing our contact tracing, and those are very important in terms of identifying cases early and taking in steps that will address transmission. There's a huge focus at the moment on vaccination, and we know that in some areas of the county we need to increase our vaccination rates, and I will ask Jyoti to speak to that, because Jyoti's been working very closely with the vaccination programme since she's arrived, and it seems a long time, but it was only a couple of weeks ago. And that, again, we need to ensure that as many residents as possible have those 2 doses of vaccine, which are absolutely essential in terms to have that better chance of and avoiding becoming ill, and importantly putting additional stress on our NHS. But that is our immediate challenge over the next few weeks. Absolutely essential we continue with what we've learnt during the course of the pandemic and what works. I'll also say that one of the important things throughout this pandemic is the support that is given to people who experience COVID, who have to self-isolate, perhaps loss of income, long-term loss of job, and also just the everyday sort of reality of how am I going to feed my children and pay the rent? And these have been very much a reality in the course of the pandemic. And those are the services, and the services that have been put in place by county and by districts have been absolutely key and in all of this. But getting those services to the right people, it's the communities and the voluntary sector have been invaluable throughout the pandemic. And so, Jyoti, would you like to say anything about the challenge of the vaccination programme at the moment?
Sure, happy to. I would also like to start by paying tribute to Val and the whole of the public health team who've worked exceptionally hard over the last year. And, you know, that really does deserve recognition. So thank you, Val. In terms of vaccination, we are concerned about vaccination. I think I would point out firstly that responsibility for vaccination lies with NHS England and the CCG, but clearly we have a keen interest in how that pans out. We were particularly slow to get off the blocks with vaccination because our primary care networks were reluctant to start. They were concerned about pressures on primary care, understandably, and it took some negotiation to get them up and running. So we were kind of behind from the very beginning. There's been much effort to try and increase the uptake, but if I give you the figures of where we're at, for Cambridgeshire overall, we're at 72.4% for the first dose and 58.1% for the second dose. And that compares to the England average of 81.6% for the first dose and 59.9% for the second dose. But further to that, there's also a lot of variation across the districts. And in particular, we're concerned about Cambridge, which has a rate of 53.4 for first dose and 32.2 for second dose. And added to the picture of increasing rates of infection in Cambridge, that is of particular concern to us. We've been working really closely with the CCG to address this issue, and they have just over the last 24 hours come up with a comprehensive plan that is designed to get us to 90% first doses by the middle of July. And that plan includes increasing the PCN coverage, increasing walk-ins through primary care networks, increasing pharmacy opportunities for vaccination, including lunchtime walk-ins in Cambridge City, more pop-ups, working with one of the big chains of pharmacies to increase access across the city and increase walk-in access. There's they're planning a super weekend for the 10th and 11th of July, where there'll be increased vaccination opportunities, also working with the university to try and get students vaccinated before they all head off home. There are, of course, concerns around availability of the workforce and the vaccine supply itself to be able to reach the level of coverage that we want. Royal Papworth have offered additional support for the workforce. There will be some sessions in the Guildhall as well. We're meeting with the East of England to address issues of vaccine supply to make sure that we've got enough. And on top of that, the council's working on campaigns to increase vaccine coverage, working with councillors and community groups, and we're looking at addressing DNAs, contacting people who haven't attended to encourage them to attend. So there's going to be a lot of activity over the coming weeks to try and get us up to the level of coverage that we need. Thank you.
Okay, just before I invite the first speaker, two sets of thanks. One, thank you for what you just said about the new initiative on vaccines. I think many of us were worried that Cambridge has the lowest rate in the whole of East of England, and the fact that we're able to announce today all of the actions, including ourselves as a county council, undertaking a campaign on vaccination take-up. I'm really pleased to see that. And also it's in the report, but I think it's appropriate to say it at the beginning. We wish to place and should place on record our deep thanks, first of all, to all our county council colleagues, your team, but so many county council staff who have taken part in the arrangements, and everyone who's taken part in the hubs and the networks around them, both voluntary organisations and individual volunteers, and also partner organisations. And it's been an immense effort, but a very successful one. And I think that's one, irrespective of our views about all sorts of different things politically, I'm sure that's one that I speak on behalf of all of us. Who would like to be the first speaker, please? Sorry, just hold on. Councillor Goldsack is first. Yes, of course.
Thank you, Councillor Howard. There are 3 amendments being brought forward, which are additional recommendations. Would it be appropriate for those to be distributed now so that people can see them before individuals start speaking?
Yes, I'm more than happy for that. Could Democratic Services do that? Councillor Goldsack, please.
Thank you, Chair. Councillor Mark Goldsack, I represent Soham North and Isleham in East Cambridgeshire. Thank you very much for everything that you and your teams have done, and welcome, Jyoti. I'm sure you're most welcome, and you've got big shoes to follow, as I'm sure you're aware. 3 very quick points from what came out. Thank you. The first one is, at this moment in time, I'm going through a certain issue with my elderly father, and I think it's an example of what's going on a lot. There seems to be real difficulties at the moment and major delays in the assessment of aged mental health issues, particularly around the early stage of dementia and things like this. And guess what? Those delays raise anxiety, raise agitation, and raise all the issues that we're seeing shown by my poor father. So I'd very much welcome, I didn't know, Val, you mentioned 4 of the 5 groups. I was hoping the 5th one was mental health.
Should we do questions?
Sorry, can I get the other points?
Questions at the end, please, Val?
Yep, okay,
yeah,
sorry.
Please.
The second point I make is, you say, Jyoti, you mentioned that the uptake, we were behind. Is it possible that we could have that detailed? The reason I ask for that is, I think if I was to tell my local health centre in Soham, the Staplow Medical Practice, that they've been behind, they would be extremely miffed at that comment, because they've been at the forefront and probably leading on numbers. So I think a generic comment across Cambridgeshire is probably ill-advised in terms of getting our people to continue the good work that they're doing. And finally, and I don't mean this entirely flippantly, but I guess it is, I for one am a very sad England football fan, and the weekend of the 11th and 12th, if you are planning on mass examples of opportunities to get people vaccinated, why not look at venues where hopefully England will be playing in the final of the Euros that weekend, because you've got every chance of getting an awful lot of people in the same place.
Some flippancy, appropriately welcome at this committee, so thank you for saying that. And I sign up as a sad football fan as well. Next speaker. Please, Councillor Wilson.
Good morning, Graham Wilson. I represent Godmanchester and Huntingdon South.
Sorry, Chair. Apologies, Graham. Apologies. I was kind of expecting an answer. Are you answering them all at the end?
No, the officers will be asked to answer all the questions at the end. Councillor Wilson.
Can I raise 2 issues? You mentioned Cambridge, but you didn't mention South Cambs. So Cambridge, could you just clarify, is there any indication that people are refusing to take up the vaccine, as we've heard in some places? Do you have any specific reasons about why Cambridge City should have low rates? And then secondly, in our papers, it talks about the instance and positivity data, and it's indicating quite a rapid increase in South Cambridgeshire. Is that an issue we should be concerned about? Thank you.
Thank you. And again, would you mind just introducing yourself for the other members of the committee?
Yeah, Graham Wilson. I represent Godmanchester and Huntingdon and South.
Thank you. We've got a number of amendments, but I'm just looking for any hands. Yes, please.
Thank you, Chairman. Claire Daunton, Fulbourn Division, South Cambridgeshire. My question relates to 2.13 and 2.14 on page 34, where you cite national data concerning the impact of COVID on mental health. I wonder what data we have locally on that. Thank you.
Please, that's Councillor Anne Hay.
Thank you. I'm Councillor Anne Hay and I represent the Chatteris Division. It's just, I would like to query why all the questions are being answered at the end, because depending on the answer to our question, we could have a follow-up question. It just seems very disjointed to me. Sorry, Chair.
I'm very happy to review it, but that was my plan for this meeting. Is there any advice from Democratic Services about what the rules or the Constitution say about that?
There's no rules, Chair. It's entirely your discretion.
Okay, I plan to continue this for today, but I'm very happy to talk with the groups afterwards when we review the meeting and to be open to comments. Councillor Bowden.
Thank you, Chair. I'm not entirely clear. Do you just want this stage of the meeting, of the debate, to be about questions, or are you inviting the amendments to be put at this stage?
I haven't got any other hands, so I'd be very happy to hear the amendments being put. I think what I can say, reading the top one, is I think it is covered by what we've heard from the Public Health team, so I'm more than happy on behalf of the committee to accept the amendment without that needing to be put, unless there are any objections to that from anyone. But on the others, very happy to hear from you.
That is very much appreciated. I think Councillor Anne Hay may have a few words to say first, though, about that, but your acceptance of it will be much appreciated.
Councillor Hay.
Thank you, Chair. I must admit, when I first saw the recommendation within this paper, I did feel it did not go far enough. And the reason I put my amendment was, having talked to people within Fenland, I'm hearing that we still have a number of residents who, for whatever reason, are hesitant to get vaccinated. And that is the reason I put this amendment forward. And I was pleased to hear that some work is being done, and I'm pleased to hear that you will accept this as a recommendation to go forward. Thank you.
And I'm very pleased that we've received it. Thank you very much, Councillor Hay. The amendment 2 is Councillor Goldsack again. Unless Councillor Bowden wants to speak first, I'm very open. Councillor Goldsack first.
Thank you, Chair. Yeah, I mean, it is exactly as it says in the amendment, which everybody's got in front of you. It's a question that I've been asked locally around the vaccination levels of care staff after the last 18 months of what our care environments and residents and everybody involved with that world has been through. And it's basically to request that we have a report presented to the next scheduled meeting as to how we're going to meet this in terms of the government's outlined intention that all care home staff should be vaccinated.
Thank you. Do I have a seconder for that amendment? Councillor Bowden, do you wish to speak, or are you just happy to do it formally?
I'm happy to do it formally, thank you.
Thank you. Are there any other speakers on the amendment? So if we can... yes, I see two there. Councillor Dupre first.
Councillor Dupre, Sutton Division. I wondered whether we could ask Charlotte Black to advise on what's happening at the moment regarding care homes and vaccination of staff there, and whether she can shed any light at this stage. I'm sure she has a lot of experience to bring to bear on this.
Thank you. Councillor Wilson.
Thank you, Chair. Sorry, I must have missed, but I didn't think you had asked for comments on Amendment 1, because I thought we'd heard that it was the NHS England's responsibility to initiate a targeted Cambridge campaign to promote COVID vaccination. And I would be slightly concerned if the county council is taking over a role which it doesn't have. So I would seek advice from officers as to whether this amendment is appropriate or not.
Okay, I'll ask them to speak after I've heard any other speakers on the amendment, but just they've already said, of course, that we will do a campaign, and I'm sure it's going to be entirely complementary to the work and in cooperation with the work of the Health Service, but we'll hear that from them as well. Any other comments on the amendment? The officers have been asked to comment. Either Val or Jyoti, please.
Okay, I'll go first, and if I miss anything, hopefully Val will pick it up. I'll start with the comment on mental health. I think that is of concern to me.
Jyoti, sorry to interrupt, but can we just focus on the amendment at the moment, and
Oh,
then
sorry.
I'll bring you back
Okay.
on, because
Okay.
there may be others on the substantive that haven't yet spoken. So just on Amendment 2 that you see in front of you from Councillor Goldsack about care homes and vaccination in care homes.
Amendment 2.
Councillor Dupre,
Yeah, I think that would be one for us with Charlotte Black and her team to pick up, and I'm sure that is already on Charlotte's agenda.
Have you got any comment, or Charlotte got any comment about the appropriateness of this, which is what we were asked?
Yes, in terms of the appropriateness of the amendment, so we are still waiting for the government guidance about the recent announcement that all care home staff will be vaccinated. But I mean, it has been decided that that will be the case. I think it would be absolutely fine for us to bring a report back to the committee, but there's an awful lot of water to go under the bridge on this one in terms of exactly what does it mean, how long a period does this have to be implemented within, and it is quite likely that it will have both a combination of public health benefit, but also will present some challenges to the care sector.
I'm looking to see if there are any other points on the amendment. Councillor Hay.
I just want to clarify when the officer was responding to the request for clarification on Amendment 1, whether or not it was appropriate for public health, when my colleague across the way seemed to think it should be NHS England. Because I was under the impression just now that they were responding to Amendment 2.
Yeah, I've accepted Amendment 1 and asked if there was agreement, and there was nodding, but I will ask the officers when they do the summing up at the end of the debate to respond to that point, so that question's been answered. Now let's move to Amendment 3. Councillor Bowden.
Thank you, Chair. Before I get to that, did you accept Amendment 2, may I ask?
I haven't called the vote. Thank you very much. You've called me out there on that one, because that's the first mistake I think I've made. Did you want to speak before the vote?
Yes, I would like to come back on the answers that are received to the question to the amendment that I put forward, if that's okay. Thank you, Chair. I totally recognise the time, Charlotte. I totally recognise that there is water under the bridge. The amendment is to the next meeting. We obviously have plenty of time before we have a next meeting of this committee. That was my point.
I think there are a lot of ethical issues also about mandatory vaccination of staff, whether it's care homes, but other staff that we might have or that might be with our partners. So I think if such a report, if this is passed and such a report comes forward, I would hope it could apply to that as well and advise us of the issues in relation to it. I'm reluctant to take a vote if I think there's consensus, so can I see some nodding? Are people happy with this amendment too? Is there any objection from anyone? No, there isn't, so that is agreed. Thank you for drawing that to my attention, Councillor Bowden. Amendment 3, Councillor Bowden yourself.
Thank you, Councillor Howard. Amendment 3 concerns health inequality, and health inequalities is a major part of our role, both in terms of our health scrutiny role, but also in terms of how we commission our public health work and also how we commission our adults' work. And here in Cambridgeshire, we have maybe one of the starkest examples of any county council of having health inequalities between different parts of our area. Some of the health inequalities in numerical terms are really shocking. Maybe one of the worst is to do with diabetes. And if you look at the incidence of diabetes, particularly in the Wisbech area, and you were to compare it with some other parts of the county, the differences are absolutely astonishing. And this is nothing new. We've had health inequalities within Cambridgeshire for a long time, and it's been identified that this is an issue for a long time. However, the report has made it clear that, in common with the rest of the country, the health inequalities that we have here in Cambridgeshire have increased as a result of what's happened during COVID. And it's not that COVID has necessarily increased the health inequalities of itself, but all the other health inequalities which exist have been exacerbated partly because individuals have not been seeking treatment for so many conditions that they do have. And we find ourselves now in a situation where what was already a bad situation is a great deal worse in our county. The report has an extremely useful schedule. It's figure 11 in paragraph 2.9, which shows the age standardized mortality rates by deprivation decile. And what's really interesting about that is, as has been expressed before, there is a somewhat greater increase in deaths depending upon where people are in the deprivation decile. About 50% difference between the highest decile and the lowest decile. But if you look at all deaths which have occurred during this period, there is a 100% greater difference between the most deprived decile and the least deprived decile. And that shows that deaths for reasons other than COVID have really disproportionately hit the most deprived decile that we have in our county. And when you look at these numbers, it's not a statistical anomaly. You can see a very clear pattern, a very clear trend, largely dependent upon deprivation, between just how serious the health inequalities have been, how serious, in this case, the deaths have been between the worst and most deprived areas and those which are least deprived. Given that we as a council and we as a committee have responsibility for trying to, first of all, identify where there are health inequalities, and secondly, trying to do something about it, I'm making a request here that we bring a paper, or a paper is brought by officers, to the next meeting, specifically to identify how we as a committee can best keep track of the health inequalities which exist within the area. Now, it's quite a complicated process. It's not as though we have a single number that we can look at and say, these are the health inequalities which exist. And what makes it more complicated, and I see Councillor van der Ven is smiling because she knows it's one of my hobby horses from being on the Health Committee before, but one of the difficulties that we have is that the data comes from quite a number of different sources, and the data also comes at different periods in arrears. All of these are lagging indicators. Some of them, unfortunately, lag a lot more than others. And that makes it technically a difficult thing to do. But it is not beyond the wit of officers to be able to devise something which will eventually allow us to keep track of whether the health inequalities in our county are increasing or are decreasing. And I think it's really important that we do that. And it's also important in all the decisions that we make that we give consideration as to whether those decisions are likely to increase or decrease health inequalities. So it's an issue which I find of fundamental importance. I hope you can accept this amendment, and I put it before the meeting. Thank you very much indeed, Councillor Howard.
Thank you. Do I have a seconder for that? Thank you very much. That's Councillor Goldsack. Are there any comments on that? Yes, please.
Thank you. Oh, no, sorry.
Is the right hand button.
Sorry about that, councillors. Councillor Philippa Slatter from Trumpington. Oh yes, I'm echoing all round now. I would like to support this Amendment 3, Mr. Chairman. My heart sings that we are able to combine health and social care from my own personal professional background. And I think that will help greatly in what I think is a very sensible idea, that we will be able to keep track of how things are going. It doesn't make the data set any easier to deal with because of data sharing. We've all stumbled over those boundaries and banged against brick walls. But on the other hand, to have input from the social care side in so many forms to give us an idea whether things are really getting any better, because certainly they have been getting worse. And you're absolutely right, if we set aside COVID-related deaths, the people who haven't been seen for one reason or another, have not applied for help, have just not got the hang of what is available because they've not seen the leaflets, because they've not been to that particular community cafe. All these things we know in our own communities. I personally would like to go and visit other bits of Cambridgeshire very soon, because I feel very ignorant living down just in Trumpington, and hopefully if somebody will invite me to tea, I'd be delighted to come and see other places. But we also do need the hard data. It's not just anecdotal. So I would welcome this. Thank you.
Thank you. Councillor Susan van der Ven.
Thank you, Chair, and thank you, Councillor Bowden. Indeed, inequalities is the foundation, really, of our work, and our new Director of Public Health opened her very first remarks by stating that as a baseline of what we're here to be thinking about. I think in terms of the new phase of this committee and this council, and also the what I hope will be a recasting of the Health and Wellbeing Board, which is a very important partner in which we play a key role, that we take a moment to think about our approach and how we want to embark on this work, rather than prepare a report immediately for the next committee. Because I think we have some thinking to do and some discussing to do with our new Director of Public Health, who's only in her second week. And the other point I'd like to make is that we traditionally look at our county in terms of geography, and while the figures are shocking, as you say, there is also profound inequality within all communities in the county. And I'm concerned that we rethink and consider how we can avoid that holistic picture. And so that is an approach question that I'd like to be able to consider before this paper is cast. And I'm sure that your amendment reflects, as I said at the beginning, the basic work of this committee. And I don't doubt for a minute we're on the same page. That is our work. It's just a matter of process, I suppose. Thank you. And I think Councillor Dupre wanted to speak.
Councillor Dupre.
Thank you. Yeah. 2.18 of our report makes it absolutely clear that there is a joint piece of work going on, undertaken by the Council's Public Health Intelligence and Business Intelligence and the CCG Intelligence team to bring together a lot of this data, which currently doesn't exist in the form in which we need to be able to make these meaningful judgments and develop policy going forward. There's also at the national level a lot of new stuff that's happening to provide more granular and more useful detail. For example, I was pleased to read only yesterday that the Office of National Statistics has done a pilot piece of work to bring together information about deprivation levels by local super output area rather than at the higher level. And that will be very, very useful to us, I think, in terms of identifying much more local pockets of deprivation and disadvantage that will be important to us in considering public health matters and COVID going forward. It's a bit like the other amendments in a way. I wasn't objecting to Amendment 1 because it's something we are already doing, and I'm sure that Councillor Hay, like myself, receives weekly the information from the council about what's going on COVID, including vaccination, including links to the vaccination mobile units and so on. And it is up to us as councillors to be using the data we're already given to target our communities. And if Councillor Hay hasn't been doing that, that's disappointing. Amendment 2. We have an amendment here which is dealing with... Sorry, I'm being interrupted, I think.
Yeah, Councillor Hay, do put your microphone off. I'll give you a chance to come back, but let Councillor Dupre finish, please.
I just wanted to make a point.
Yes, but I'm saying that you're not to speak. I'm really sorry, but I want to ensure that we have respect and courtesy. I will be calling you to come back so you can answer that, but I will also ask Councillor Dupre to finish. I'll also take any points of order, but I will ask Councillor Dupre to finish first.
Thank you.
What's the point of order?
The point of order is that under the Council's constitution, it is permitted for any member to raise a point of personal explanation if they believe
I am aware of that, of course, and I will take it when Councillor Dupre is finished. I'm very aware of the constitution, Councillor Bowden. Councillor Dupre, please.
Thank you. As for Amendment 2, I mean, obviously these are things that the Council is aware of and that officers are working on. But Amendment 3, I think, is trying to run before it can walk. I don't think we have at this stage the kind of data or the ability to ascertain the kind of data that's necessary to do something that is going to be meaningful at our next meeting. I think we need to be aware that the report explains that things are already underway, and I don't think that putting an amendment actually makes that happen any faster. And if it tries to make it happen faster, then it won't happen as well and as thoroughly. And I think we need to do these things properly, be aware that this is already going on, and agree to move forward on that basis. It is very important that we gather this data and that we use information about inequalities and about what's happening in different communities for different reasons. But we've got to do it right and not just try to gain brownie points by saying let's do it at the next meeting when we're not ready to do it.
Short statement of explanation, Councillor Hay.
Thank you. I take great exception to the insinuation put forward by Councillor Dupre that I do not read or take notice of the information that we are given about public health. Of course I do. And because that insinuation has been put out in the public domain, I would ask that she gives me a public apology.
That's your statement of explanation. I can only take any hands that are thrust in my direction. Let's deal with the amendment. Councillor Bowden, it seems to me we could perhaps have consensus if you were willing to withdraw the words to its next scheduled meeting. If you also would be happy with my assurance that if it's ready, it's ready. There's going to be no delay on it. But if when we sit down with the officers afterwards, it seems that we can do a better job a bit later, we'll keep you informed, then it may not be the first meeting. Would you be happy with that suggestion?
Councillor Hurt, I would have been happy were we not only having one meeting every 3 months. And if we were to have a delay for 6 months rather than 3 months, I would feel it is time which is wasted. This is a very permissive amendment rather than a prescriptive amendment. It gives officers a wide range of options about what they come back with, and if they come back with something which tells us they are not ready yet, then so be it. But I think it's such an important issue, and it should be top of our list of priorities, in my opinion, that it is appropriate for us to hear at the next meeting either what could be done or what is in the process of being done. So I would like to leave the amendment as it is. Thank you, Chair.
Okay, I'm just going to take it to the vote that now. All those in favour...
Again, on a point of order, given that there is some dispute on this particular issue, I would like a recorded vote, please, if I may have, which I'm allowed to have, if I have the agreement of 4 other members.
Do I have 4? Could members show if they want a recorded vote? My only comment, and that's agreed, my only comment is this. I regret the slight exchange that took place across the floor. I hope and believe it wasn't intentional to cause any personal embarrassment. I hope very much as a committee we can seek maximum consensus, deal with each other with respect and courtesy, and certainly avoid personal attacks of any kind. And that, I have to say, is my expectation, and I'm sure everyone's heard that. But let's deal with the amendment, and it's a recorded...
Thank you very much.
I'm thinking about whether to call you again, Councillor Hay, because I think it's been finished, so in fact I'm not going to call you. I do apologise.
Oh, this is ridiculous.
Well, I have to hear what the point of where it comes in our constitution that you wish to address me.
My point of order was that I understood that you had proposed an amendment to the amendment, in which case you would be taking that amendment first. Is that correct?
It could be done in that way. I wasn't. I was making a suggestion to Councillor Bowden, but if someone wants to do that, I will recognise it.
I'd like to propose that amendment.
Okay, I'd see that from Councillor Dupre, and I see Councillor Wilson seconding it just before Councillor Slatter. I'm keen to come to a vote now, if I can ask for the committee's cooperation. We haven't been asked for a recorded vote on Councillor Dupre's amendment.
You have now, Chair.
Only if I see five arms? Okay, it's recorded. Here we go. I will call the names. I think one or two people are still missing, but I'll call all the names to make sure I don't miss anyone. So this is on the amendment from Councillor Dupre to just remove those 4 words. Councillor Smith?
It's Councillor David Ambrose Smith from Littleport.
So can I look? Because we haven't talked yet, so I do apologise.
No,
and perhaps you
Ambrose
could
Smith.
just introduce
I
where your
I just
division
did.
is.
I just did.
I didn't hear you. I do apologise.
Okay.
Could you
Councillor
repeat it?
David Ambrose Smith. Ambrose Smith is my surname, from Littleport.
Okay, we've not met before. Sorry
Thank
about
you
that.
very much. And that was against.
Against. Councillor Bird.
Councillor Jerry Bird, and I'm representing Chesterton in Cambridge, and I'm for.
Councillor Bowden.
Against.
Councillor Costello. Not here.
Hello, I'm a Councillor Adela Costello and I represent the Ramsey and Berry division, and I am against the amendment.
Thank you very much. And you were against the amendment? Yes, sorry, I didn't hear that. And you're very welcome. Councillor Daunton.
Yes, I'm for the amendment.
Councillor Corney.
Councillor Steve Corney, Warboys and Stookley Division. I'm against the amendment.
Councillor Dupre.
And I'm for the amendment.
Councillor Hay.
Against.
Councillor Gay is not here. Councillor Goldsack.
Against, Chair.
Councillor Howitt, for. Councillor Reynolds. Not here. Councillor Slatter.
Councillor Slatter, Trumpington. May I just check that I am voting on the right bit? The words to be deleted are to its next scheduled meeting. Is that correct?
That's correct.
And I'm for that amendment. Thank you.
Thank you very much. Councillor Wilson.
For, Chair.
And Councillor Van der Ven.
For.
Democratic Services, can you give us the score, please?
Yeah.
Sorry, Chair, I couldn't press my microphone. So that's 7 votes in favour, 1, 2, 3, 4, 5, 6 votes against, therefore the amendment's carried.
Can I just check you still want to proceed with the substantive, Councillor?
Yes, I do, if I may, Chair.
And you wanted a recorded vote on this, so we'll just go down the line again.
No, Chair, given that I believe now that everyone is going to be supportive of it, I believe there's no need for a recorded vote, assuming that everyone is now satisfied.
I'm extremely grateful to you for saying that. Can people nod at me if you're happy with Amendment 3 as amended? Yes, I'm seeing that, and thank you for putting the amendment. I think we're going to come to the officers to answer questions throughout the debate. Just 1 or 2 myself that I'd like to add in. I was very interested in the graphs on excess care home deaths in Cambridgeshire, and Clearly that was the cause again of some controversy in the former county council over the proposal to have an inquiry into that which wasn't supported by the former county council. I don't want to go back onto that and to refight an old battle on that, but I am interested to hear your comments about excess deaths in care homes, and just to give us more detail about what you think was going on there in relation to care homes, obviously elsewhere in the country. I join with other colleagues who've asked you to comment on why Cambridge has got the lowest rate of vaccination in the region. I think it's important to understand that. Could you just give us a bit more detail on the Fenland Enduring Transmission pilot? I think that's a really interesting piece of information you didn't get a chance to cover in your presentation, but the link to low pay work, poor housing conditions, I think it's not completely interconnected with the debate we just had, but I think that would be good for us to hear as well. And in fact, I'll stop my questions there. That's 3, that's enough. So, Jyoti or Val, whoever wishes to go first. Not just for mine, but for all of the questions you've heard, of course.
I'll kick off, and Val can add in some areas that are of particular interest to her. Taking the point about mental health, I think that's a really valid point. I think we were almost at crisis point before COVID hit, and things have definitely gotten worse, and I think that would be mental well-being, mental health will be one of my key priorities as we start to think about recovery from COVID. Apologies if you felt there was judgment being made about PCNs. I have nothing but admiration for my primary care colleagues who've worked incredibly hard through the COVID experience and are feeling the pressure as we start to recover and try to recoup the backlog of activity that they haven't been able to meet over the past year. I will make your suggestion about football events back to the CCG, and hopefully they will take that up. South Cambs versus Cambs vaccination. I can give you the figures for South Cambs. They're actually better than the Cambridgeshire area itself. So Cambridge is at 53.4 for first vaccination. South Cambs is at 79.7 for first vaccination. Cambridgeshire is at 32.2 for second vaccination, and South Cambs is at 58.1. So it's fairly in line with, slightly below the England average, but a lot better than Cambridge. With regards to what's happening in Cambridge and why the rates are lower there, I think that's probably a combination of factors, some of which I can't explain, but one of the potential explanators is that they've got a younger population, and so the younger population have only recently been able to get their vaccine, so that's part of the picture. It's not the entire story, and I can't explain. I don't know exactly why it's so much worse than the other areas. I think I've answered most of the... Can I comment on Amendment 3?
I'm sorry, but I'm also clock watching and also trying to...
I'll leave it there and I'll hand over to Val.
Happiness and good order in the meeting. I'm sure your intervention would have been, but I think we'll leave the amendments where they were. Val.
Okay, I'll hand over to Val then.
Yeah, I'll probably add just a little bit, basically, because I've been here a bit longer than Jyoti in terms of mental... Sorry. Apologies. Just to add a little bit to mental health, just because I've been around a little bit longer than Jyoti. The mental health is certainly, we've worked closely with throughout the pandemic in terms of focusing on people who use mental health services. We've had a particular amount of work focusing on people who come through our drug and alcohol services with mental health issues. So, and taken forward by our local, working closely with our mental health trust, we've appointed a new data post to tease out the issues that are affecting people who with mental health problems that have been, let's say, exacerbated during the pandemic, but also have come to the front during the pandemic. So a lot of work has started, and part of that piece of work of trying to understand the data around the impact of COVID, it feeds into that as well. In terms of the concern about South Cambs and the wider picture of the infection rates, we are concerned about South Cambs because, again, we know that our rates are increasing in our 18 to 24-year-olds. The 18 to 24-year-olds in South Cambs tend to come into Cambridge City, and we know that one of our main causes of transmission is the unlocking and the venues, the hospitality venues. So there's a lot of concern around this part of the county where we have a younger age group who do like to socialise and use our very good hospitality locations. In terms of Fenland, certainly, and that's very much in response to the enduring transmission question. Just for those who are not aware of the enduring transmission pilot, back earlier in the year we had a visit from the Cabinet Office because of very high rates and enduring transmission. That's where transmission and the infection is very well embedded into the community. And that visit took place across Fenland and Peterborough. On the back of that, we were asked to submit a proposal for how we would address enduring transmission in the community. We were very much aware that this was very much linked to lower paid workers. Lower paid workers very often on 0-hour contracts. And so if they did have to get tested, did have to self-isolate, they wouldn't perhaps get any income, just minimum sick pay. And we knew that these were acting as barriers. So the bid that we put through has 4 or 5 main objectives that focus on security of income, security of contract, secure COVID-safe transport and COVID-safe accommodation. Our bid was successful, one of 11 in the country that had this money. It's 2.6 million over 3 months. That does include working with South Holland in Lincolnshire as well. So it covers South Howland, Fenland and Peterborough. It involves working very much with local employers, particularly in high-risk industries where these workers are most prevalent. The food sector, especially food, and that's from food production, packaging and distribution, and through to the construction industry as well, where we know there are a lot of low-paid workers. And they experience those higher risks with COVID and the knock-on effect in their reluctance to... it's a reluctance that's born of having somewhere to live and basically exist if they are asked to self-isolate. The work has started. We are about 2 weeks into it. We've already established a different way of payment mechanism, working through a third sector provider, the Rosmini Centre, as we know that one of the barriers to many of these communities engaging with the system and actually accessing benefits which they're already entitled to. So that's one of the major hypotheses of the bid, that we will work through our accepted community third sector organisation. So that's the enduring transmission bid, and it is being observed quite closely, and we are monitored quite closely on its progress. In terms of you asked about, I think, Cam City, and I think, Jyoti, you answered that, didn't you, in terms of it's quite poor understanding. And I don't think if there's anything else that I've missed, please ask.
Just Councillor Wilson's point to reassure the committee about what we're planning to do on vaccination campaigns being complementary and not in contradiction to what's been done by the health service. And I think you've also committed us to do some more work on black and minority ethnic communities. Yeah. So I think that applies to both. Could you just answer that question, please?
In terms of the vaccination campaign, it is a very much, although I think it is the NHS, as Jyoti has said, an NHS England and CCG responsibility to deliver the vaccination campaign, but to deliver the vaccination programme, it is the responsibility of partners around the system to make sure that that actually is promoted and people access it. And we have a very robust group which is led by one of the directors, Adrian Chapman, in the County Council, the Vaccine Confidence Group, which brings partners together across the county and has developed an ongoing campaign to promote vaccination. And at the moment, it's very much focused on Cambridge City as well. And that's and that involves everyone in the system, and it obviously is targeted at areas over time where we need to most address attention to.
That's fine, thank you.
Okay.
And I think in the spirit of Amendment 1, it's for all of us. I think that's what we as a committee are saying. I think anti-vaxxers are deeply evil, wicked people that are threatening us all, and we've all got a personal direct responsibility and duty to speak out for vaccination. Councillor Bird, we have closed, so it'll have to be short, I'm afraid.
Really, it's a concern in the GRT, Gypsy Rome Travellers. I have a concern making sure that they're getting vaccinated. We have a big group in East Chesterton and, of course, King's Hedges areas, and then the people that actually come into the city. So I'm just wondering if anything is being done there. And also this Saturday we've got a big traveller community coming to Midsummer Common. Would that be a chance to test them and see if they'll have their injections? Thank you, Chair.
Thank you for doing that briefly. Again, a very brief answer from one of Jyoti or Val, please. Sorry, with the microphone on, sorry.
So we work very closely with the traveller community, and we have numerous teams both in public health and working with the districts, and we have worked at and targeted them and offer them both testing and vaccination. So there's there's a lot of ongoing work with that particular community.
And Councillor Bird's point about possibly a presence at Midsummer Common?
Yes, we do keep a constant watch, and obviously we seek out intelligence of any of such events. And I think they are very good opportunities to either test or to vaccinate as well.
Okay, I think that's been heard, and they'll go away and look at it, is what I hear from that answer. Okay, the recommendation was to note and comment on the report. We've had lots of comments, but I think it's been a very worthwhile and important debate, so I thank all members for taking part in it, and I think the recommendation has, of course, been already agreed in that sense. We now move on to our second strategic issue, which is item 7, realising the potential for the integration of health and social care. That's on pages 59 to 70 of the agenda pack. And good morning once again to Charlotte Black. Yes.
The matter of housekeeping. Directly behind me, there's a door open onto the street, and I'm getting a cold draft on my neck. I can't see me sitting here for 5 or 6 hours with that. Can somebody ensure it's closed?
Okay, could one of the Democratic Services colleagues come and see you to try and assist?
Chair, is that not necessary for sort of COVID ventilation? And is it possible that Councillor Hay could be moved?
I'm keen to proceed. It may well be that Councillor Hay could perhaps get a better seating, but I'd rather the two of them talked about it and came up with something happy. I don't think we need to debate that as a committee. Although it's a very fair point, Councillor Dupre. Charlotte Black, thank you very much.
Thank you, Chair. So I'm going to introduce this paper very briefly. The purpose of this paper is to give the committee a bit of an oversight, really, of where we are in terms of the integration of health and social care, some of the opportunities that are ahead of us locally in the national context. So it's really to stimulate discussion and debate, and it's in that spirit, really, that it's been written. So I won't go through it in detail. It sets out what many of you will be aware of, which is there's a significant change taking place at the moment, which was set out in the white paper called the development of integrated care systems, and that's happening across Cambridgeshire and Peterborough. That involves a lot of changes within the NHS, but the local authority is a key partner in that, both in terms of adult social care, children's services, but also public health. The paper sets out the different levels in which the integrated care system will operate, and this is nationally prescribed. So there is an overall integrated care system, and I'll give you the sort of terminology just so that when we use it in future you kind of know what we're talking about, because there are a lot of acronyms. And that's Cambridgeshire and Peterborough, and sitting underneath that will be integrated care partnerships, which are currently the North and South Alliance, which have been operating for some time. And then the level below that is what we call integrated neighbourhoods. So at the moment, those are based around primary care networks, but there's quite a lot of discussion happening at the moment about what does that mean in practice. There's also work underway to develop a number of what are called provider collaboratives. These aren't terms that we've come up with locally, they're nationally prescribed. And what that actually means in practice is that the CCG as a commissioning body will no longer exist in its current form, and many of the functions that it currently delivers will be delivered by what are currently the main NHS provider organisations. And then we really go on just to give you a bit of a potted history of what's gone on in Cambridge in terms of integrated services. So at one point, the County Council did transfer all its budgets and all its staff for older people services into the NHS. That was kind of several years ago, around 2012-13. It was a good experience in terms of it demonstrated the importance of health and social care working together, but it was probably, I would say, more focused on governance and the sort of structural change. And I think on reflection, we probably, all of those involved, think that perhaps we could have done more to really think about this in terms of the experience of the people using services. And actually the County Council, some of you may remember, made a decision to actually transfer service staff back into the County Council because there was a concern about sort of professional direction and financial control. However, we've continued to work really, really well across health and social care, and the paper describes a number of integrated arrangements that we've got, often called Section 75s, which is a legal term, but we have an integrated model for social work. So our mental health social workers are actually managed and based within the Mental Health Trust, working alongside clinicians. We have a similar model for occupational therapy, so the NHS actually provides the occupational therapy service for us because you get a better join-up, basically, between health and social care occupational therapists. We have a fantastic learning disability partnership, which I think the organisation can be really proud of, which is absolutely a multidisciplinary team, basically involving health and social care staff, wrapped around individuals with learning disabilities. And we have two integrated services for community equipment and for assistive technology. So although we did make a big change in 2012, we also left a lot of things in place. And the paper describes some of the other ways in which we work in an integrated way that haven't required any legal formal arrangements. They're just how we do our day-to-day business. The paper also goes on to describe integrated services in public health and commissioning arrangements. And then we describe what we think are some of the kind of opportunities, really, for going forward, building on the learning that we've got from Think Communities and the Neighbourhood Cares pilots in Soham and St Ives. And some of the opportunities that we wanted to highlight for you are, we think there's more that we could do to build on the Neighbourhood Cares pilots and the integrated neighbourhoods, which, as I was saying, are part of the ICS, the Integrated Care System, are very interested in the learning from those pilots and are currently studying the evaluation report again, which is really encouraging. We do think, although we're not very keen on the term provider collaboratives, we do think there's an opportunity to build on our learning disability arrangements. A councillor earlier mentioned the importance of information sharing across health and social care. This is a long-awaited moment, but we are going to be having an integrated health and care record. That process has just started to get going. And there's also significant opportunities around reducing health inequalities and other opportunities in public health. So finally, at the end of the paper, we do draw your attention to some areas for discussion in section 6. I won't go through those line by line, but they just might be areas that the committee would like to focus on in terms of the discussion that follows. And we're very interested in any views that you have that we can take forward from this meeting.
Thank you very much for that. And indeed, this is a long-term strategy paper, and so those questions can inform our discussion. We're not making any decisions today, but assembling our own collective view and giving feedback to our officers. Councillor Bowden.
Thank you, Councillor Hart. I very much welcome this paper and welcome the statements which are within it. This is not the start of a process. This is a process which has been going on and has been talked about. In fact, it's been talked about more than it's been going on for many, many years. And it's very welcome indeed that progress is being made in the direction which it's going in. It is really important, however, that ultimately we recognise and that we've all got to look at the whole system rather than continuing to concentrate on our own silos. And this initiative is designed to help going in that direction, and I wish it the very best of luck, but on past performance, I dare say it will fail to achieve all that is hoped for, because the health system, I'll put aside the social care system, but the health system is very large, and it's very difficult indeed to make changes within the health system. I do hope that we make as many as we can in order to achieve the objectives that we've got. Because there is a fundamental imbalance within the health and social care system at the moment. Assuming that we do want a preventative system in place rather than a reactive system, assuming that we do want to look at the system as a whole rather than in individual parts, it is essential that we have a rebalancing, first of all within the health system itself, between the acute sector and primary care, where primary care is hopelessly undervalued and under-resourced, and secondly between the health system and social care system, where social care can far more cost-effectively deal with many individuals rather than them ending up being dealt with almost by default very often within the health system, which is a very expensive way in which to deal with individuals. So I very much welcome what is being suggested here. It very much builds upon what had been done by the previous administration so far as a neighbourhood-based approach. And it really does make sense for us to move down this direction as far as we possibly can. I'm sorry if I sound at all cynical, but it's just that this sort of initiative has been pushed forward so many times in the past and has never achieved its full potential. I hope this comes as close as possible to achieving the potential which it's got, because the potential which it's got is absolutely enormous. So I very much welcome this report. I very much welcome the work which officers are doing. I very much welcome the approach, and I wish officers the very best of luck in achieving the objectives.
Thank you. Councillor Daunton.
Thank you. I really want, it's a point of clarification actually. I'm looking at little Roman 4 on page 70, support for neighbourhood and place-based multidisciplinary approaches, building on the neighbourhood cares pilots. Could you just explain what you mean by place-based in that sentence and how that differs from neighbourhood? And also, could you just indicate to us where think communities comes in, the whole process, the whole notion of think communities comes in relation to that particular sentence?
Thank you. Councillor Dupre.
Thank you. I'd like to join in very much welcoming this report. I'm very enthusiastic about it, and I think that I'm a lot more optimistic about it than Councillor Bowden is, and I'm not normally an optimistic person, but I hold some hopes for this. I think it demonstrates how absolutely right it was to bring adults and health together into a single committee where we can look at these issues in the round and where we can bring together officers. And I've been really impressed how our officers have risen to the challenge of bringing these two teams together. It's absolutely in the mainstream of where all of this is going, working together, bringing health and care together, integrating the services we provide. And I think that in itself will help to maximise the local democratic input, as Little 2 says, and I hope also make the developments that are going on more meaningful by bringing those discussions together into a single place, into a single space within our structure. I think that's really excellent positive news, and I'm sure that will bring benefits. I think also that we need to be continuing to ask for the maximum possible openness and transparency, particularly among our health colleagues, for whom perhaps that sort of discipline of open decision making that we have in councils has not always been the norm in the health sector. I know that there have been huge moves forward with that, and I'm really looking forward to seeing these decisions and these discussions taking place in a more open forum, and I think we need to continue to be arguing and pressing for as much information as possible to our community so that they have a sense of these decisions and discussions being held for their benefit in the open rather than being done to, which is never a good feel. So I'm very positive that this is going to mean a more open and transparent and joined up way of doing things, and it is totally in the mainstream of how things are going, and I'm enthusiastic about it and very positive.
Thank you. Councillor Slatter.
Thank you. Yes, I too welcome so much in this paper. The Neighbourhood Cares project, I saw the video, which always helps to have visuals, doesn't it? Looked great, and I want to go and visit both places of the experience, and the sooner we can all have that, the better. I am concerned that we shouldn't have two successful pilots into which a lot of money has been put and a whole lot of gaps, because it's the gaps that worry me. And this business of co-location, it may be, as we are in Trumpington, blessed with a great big new building which actually co-locates. You still have to make sure that people talk amongst themselves in the same building, but also in some places where you might have a village hall and a school, and we can sort of cobble together a neighbourhood cares. This is going to be very much a matter for the county councillors with their local knowledge, not just the people on this committee, but I think we need to spread the word to our colleagues in other divisions to come just to identify those places where the neighbourhood cares system could be used within quite small and maybe under-equipped villages, where we can use what we've got, make the most of what we've got, perhaps put some extra resources in, but it's often the matter of joining things up that are there already, which is obviously what we do for a job, isn't it, really? So thank you for this. As I think I mentioned before, my heart sings with some of this stuff. It's very much my own background, and it's lovely to be given permission to cross the boundaries. Thank you.
Very good, thank you. Councillor Bird next.
Thank you, Chair. I've got two questions. We have the Learning Disability Partnership Board. We used to have the Physical Disability Partnership Board. I just wondered what's happened to that. My other question is about the OTs. How long is a waiting list? Because in the time from leaving hospital and actually getting to see an OT could be 18 weeks, 20 weeks, and in that time the person's deteriorated more. So they need the help as soon as possible. So I'd like to hear about that. And also on the care system, where some of the clients are not actually getting the proper care they should do, the time they should have is cut down to half or 3/4. So I'd like some feedback on that as well, Chair.
I'm going to take Councillor Goldsack next, please.
Thank you, Chairman. In response to Councillor Slatter, I was on Adults Committee in the previous term, and I'm also the member for Soham, where we were very fortunate to have the Neighbourhood Cares pilot run. You'd be more than welcome to come and have a look and meet the people. But let me just share one thing with you, and I think this encompasses everything we do and where this paper is going, which I join the chorus of broadly being very delighted to see it. The local primary care health service in the town, as a result of Neighbourhood Cares pilot, employed a social prescriber. And that person's job is to work with the voluntary sector in the area to take somebody that's, an example could be that's a little bit low and a little bit down, an aged man that's not getting out of the house, getting under the wife's feet, etc., and they prescribe them to the local man shed that's been created or something like that. That's a very physical example. Now that is a direct result of coming out of this. So for that and for all of the other reasons, I do very much welcome this. The only question I would leave, Councillor Dupre took the opportunity, and I don't blame her for praising the joining of the Health and the Adults Committee. Where does this leave children's health in relation to this and this form, please? That's my question.
Thank you. Councillor Wilson.
Thank you, Chair. I wanted to ask a question about provider collaboratives. I share Charlotte's view that the name's a bit confusing and it's certainly new to us. but what are the implications for internal markets now and competition? And does it have any implications for our own procurement arrangements? Can we be a bit more flexible than perhaps we've been in the past?
And my own contribution, just before I bring Charlotte back in, of course I really welcome this paper, but also the fact it's been welcomed on all sides of the committee. I think that's very, very healthy and good in terms of us going forward. I still think there's too much about governance. I think we've got to learn the lesson. You know, I think we have to have governance, but to make it as transparent and based on need as possible, I think is very, very important. I just draw attention to the point in the report about the officers looking at how the Health and Care Partnership will work together with the Health and Wellbeing Board. In Leicestershire, we've discovered there's actually one. There aren't two bodies. And so there is an internal discussion going on, which I know you wanted to air at the committee, where we just look and consider how we can get rid of any duplication without getting rid of proper scrutiny and democratic accountability. I think, Councillor Bowden, your challenge, I don't think it's a challenge to the officers, I think it's a challenge to all of us. You know, I don't know one person who doesn't say it's a good idea to integrate health and social care. And many have tried, and I agree, many have failed. But I think we have to wrestle with the issues. Money is obviously one of them. And I think it's our duty to work with our officers on the problems. And I see that as being part of the work, not just that issue, but others over the months and years to follow. Jargon I hate, so the more we can just get rid of jargon, the better. I think if the old administration had place-based, asset-based neighbourhood pilots and think communities, it's probably very, very good, but it doesn't need 4 names. And, you know, I think this is something we've got some advanced thinking about in our service area, but I know other committees of the council will look at. But I think sometimes we get sort of our eyes blinded by all of that type of jargon. So let's get into what this really means. And I think our colleagues in the Communities, Inclusion and Social Mobility Committee will be doing that, and we should support that and perhaps put in our views and our experience to that. And I invite our officers to do it. I do have a couple of questions. I hate provider collaborative as well, but you've told us already it's a national thing and we're not allowed to change it. But it does mean getting rid of the purchaser provider split in the health service, which is a jolly good thing as far as I'm concerned. So how we react to that, I think there's a very interesting and serious question beneath it. Are we, Charlotte, thinking about more Section 75 agreements than the one we've got already? What's the current state of doing mental health as well as learning disability in the provider collaborative? That's actually quite an important, I think, bit of new information we're seeing today, which is massively increasing integration, and we hope it works. So a short word about that. And actually I echo the question from I think it was from Councillor Slatter, and I apologise if I get this wrong, but if it was nearly £1 million for two neighbourhood care pilots, can we afford them, and what are the challenges going to be there? Charlotte.
Thank you to the committee for your comments and feedback. It's really, really useful and much appreciated. So I'll pick up the questions. There's a couple that I'm actually going to ask Will to pick up as the Director of Commissioning. So the challenge, which I think is fairly made actually, about what do we mean by terminology is really important. There is actually a sort of, I think the terms neighbourhood and think communities and place-based do get used rather in a rather loose way. But there is actually an important point in this, which is that within the NHS are now starting to talk a lot about place in a very specific way. And so what they mean by that is they actually mean, I think, I'm hearing it a lot at the moment, I think they mean the North and South Alliance, which is basically the north of Cambridgeshire and Peterborough and the south. It's not completely coterminous with the county council boundaries. That's much more around, really, is around the hospital and the acute pathways. So it doesn't necessarily make a huge amount of sense for the local authority. So there is an active debate going on at the moment about what do we mean by neighbourhood. And I think recently a conclusion that the term neighbourhood is probably the most useful one to use at this stage. But I think it's a fair challenge, and I think it's helpful just to remind us that we do need to be clear about what we're saying. And certainly from the council's point of view, we will continue to try and get that clarity, but there is a lot of that kind of talk at the moment. In terms of where does Think Communities fit, I think Think Communities was sort of designed as an approach and a set of principles that would be applied across adults and children's services, actually, and still very much prevails. In terms of the questions about the sections about the partnership boards and is there still a physical disability board. There isn't a specific physical disability board. At the moment, we have a learning disability board which oversees it's the formal governance for the Section 75 for learning disabilities. And we also have a series of partnership boards which are actually an opportunity for the people who we support to give us feedback about our services. So there isn't one specifically for physical disability, but we do get representation from a number of organisations into those partnership boards, and we'd be happy to share a paper summarising the work of those boards and the difference they've made. A question about OTs, occupational therapists, and the waiting list. I think this is something that so obviously because we don't deliver the service ourselves, this is something that Will's commissioning team keeps a very close eye on in terms of our Section 75 with the Mental Health Trust for occupational therapy, and they have recently made some really quite significant improvements in their waiting list, but we continue to monitor it and the decision-making process because they did at one point have to redeploy a lot of their occupational therapists from low priority work to COVID-related work, so that's something that we are actively working on. I think, Councillor Bird, you actually raised the query about the care system and the number of 15-minute calls at another forum. We are gathering that information, and that's very much on our to-do list. The question around children's services, where does this leave children's services? I think it's really important to recognise that although today we're discussing adults and public health, the idea behind the Think Communities approach is that it is whole community, and it's recognising that people are in families and communities and can't be sort of separated out into client groups to suit us as an organisation or as officers. And so hence the reason why we have a sort of people and communities directorate, and we have the Think Communities initiative, and certainly Wendy Ogle-Wellborn, I think, is always very clear with us that the expectation is that that looks at all population, aspects of the population. The only other, in terms of your question, Chair, about the current state of the provider collaborative for mental health and learning disability, it's really early days. It feels at the moment that it's an idea. And obviously what we're doing is saying, well, what we want to bring to the table is the very good experience and the example that we've got of the Learning Disability Partnership, which should be something we build on rather than try and start again, and that has been accepted as a way forward. The challenge around, wouldn't it be lovely to have a neighbourhood cares pilot everywhere? It certainly would. The proposal that we made in the sort of following the pilot of neighbourhood cares was it is something we wanted to roll out everywhere, but it's not something the county council could do on its own because it simply doesn't have enough resources. So to really work, I think it would need to be an approach which actually brings in all the public sector resources into sort of one kind of coordinated system. And I think that's really what the work on integrated neighbourhoods is fundamentally about. And I was just going to ask if Will could answer the question around the implications for procurement arrangements of the provider collaborative, and are we going to have any more Section 75s?
Thanks, Charlotte, and thanks, Councillor Wilson, for raising the question around provider collaborative. So under the current arrangement, the CCG commission individual organisations directly, and as you know, will part of that is quite a significant amount of contractual management. And moving towards the ICS and specifically the ICP, our understanding is that the funding will actually be allocated, so those budgets will be capitated and allocated to the ICP as a whole, and that those providers within that ICP collectively manage those monies to meet outcomes. And obviously from a social care point of view, we're very keen and have started conversations both with the ICP and with the CCG about, the local authorities' role in terms of allocating and pooling resources, including funding, into the ICPs and the neighbourhood levels. So our understanding is that, as we stand today at least, that the procurement in effect, there is no procurement in the sense that the money is allocated to a collaborative, and that collaborative hold that collectively.
Okay, any more Section 75 agreements in the offing?
That's not currently, there is nothing else at the moment that we're planning to develop as a Section 75, but it's a tool, it's a sort of instrument that's available to us should we want to, but does involve quite a lot of work.
May I ask what 75 of what?
So Section 75 agreement is it's basically a term which describes the local authority can delegate some of its functions to another organisation, and because it's another public sector organisation, rather than it being a contract or a sort of service level agreement, I mean, it has the similar status, but it's just something, it's a delegation of one responsibility to another organisation.
It's part of a local government act? It's 75 of what?
I would need to double check.
It's a bit like we thought 106, but anyway.
The Local Government Act 1972.
Where did that come from?
Brilliant.
Thanks to Google, I have to say I didn't know.
That was a voice from on high.
I didn't know you were a lawyer as well. So thank you. Thank you. And also that was, Will, the first time you've spoken today. So just to introduce Will Patton, Commissioning Service Director. You're very welcome. And I think you were doing the next item as well. So the recommendations on that report were to note and support the further integration of services, to note the national and local context and the opportunities presented by the establishment of integrated care system, and to support the proposed focus on developing a neighbourhood-based approach, and to explore the opportunities in more detail going forward as committee and with integrated care system partners. Is everyone happy with those recommendations? Lots of nods. That is agreed. Thank you to everyone for a very rich discussion. We move into the decision items of the committee. I do think we can deal with these a bit quicker. I won't close down debate, but I do think we can speed up, and also the officers in their presentations, we've all read the papers. So we start, let me just check I don't get the order run, with item 8, renewing home care support for hospital discharge. That's on pages 71 to 82 of your pack, and it's Will yourself that's going to present this.
Thank you, Chair. So yes, I'd like to introduce this paper. We have invited the lead commissioners along to come and talk through the proposals in a bit more detail. And for this particular item, our lead commissioner is Shauna Torrance, so I'll hand over to in a moment. So what this paper in summary is asking for, that we want to recommission some hospital discharge capacity. It's a service that has been in place actually for some years, and that current contract is coming to an end. We are wanting to for the service to continue. It's been a really successful service in the sense of helping us get people to home from hospital, and the proposal is that we recommission that on a 5-year basis at a cost of just over £10 million. Okay.
And I think that's Shauna, because she sort of nodded at me. So again, some of the colleagues here you won't have met and we'll be getting to know very well. So Shauna works with Will and she's Head of Commissioning for Adult Social Care. Shauna Torrance, please do come in.
Thank you, Chair, and good morning, Committee. So, as Will has outlined, the report is requesting approval from committee to recommission this provision on a 2-year with 3 one-year extension clauses at a total cost of £10.12 million over the next 5 years. It is also seeking approval to delegate award and extensions to Executive Director of Peoples and Communities.
Chair, I can't hear her very well. Could you possibly speak up, please?
Yeah,
apologies.
The best thing is just to point the microphone at your mouth and get as close to it as you can. Thanks.
Can you hear me now? Is that
much
apologies.
better? Thank you.
So the current contract is funded with health partners through an integrated arrangement through the Integrated Better Care Fund and delivers 253 hours of home care a week at an annual value of just over £2 million. It's really important that this service is maintained to enable the Council to continue to meet its statutory duties, to meet the assessed needs of people in a timely way on discharge from hospital through the delivery of a guaranteed number of home care hours. The service is time limited and outcome focused and aims to work with the needs of each individual in a flexible way to ensure they can recover within their own home. Following this, the service supports individuals to access longer term arrangements, adapting and reducing support where appropriate and in line with their recovery. However, as outlined within paragraphs 2.1 to 2.7, there is room for improvement that we will aim to address within the procurement. Key areas being the current length of stay being way beyond the 6-week target and a lack of provision to meet the needs of people on discharge from hospital who require 2 carers. As outlined within paragraph 2.10, we intend to address this through increasing the number of home care hours for people who require 2 carers to deliver their support. Focus capacity on meeting the needs of people on discharge from hospital, aligning to the work we are undertaking with health partners to develop more effective pathways within this area. We intend to use a small incentive to providers to support and encourage ongoing improvement of outcomes for people accessing the service and transitioning into longer term care arrangements. We will closely monitor and manage utilisation of this service to ensure best value for money. And finally, we are seeking to ensure the service is more environmentally sustainable through developing more efficient home care rounds, reducing carbon impact and placing a requirement in the tender to use electric or hybrid vehicles to deliver the service. This is a new development within this area, so may require some additional investment depending on the tender responses we receive as part of the procurement. These improvements are taking place within the wider context of another piece of work to develop a more place-based approach, linking to the report we've just heard from Charlotte. And will seek to develop local home care capacity within communities and empower people to take more control and have more choice over their home care arrangements through the use of mechanisms such as direct payments and individual service funds. Overall, it is envisaged that this approach will enable people to return home in a timely manner with flexible and outcome-focused support to enable them to recover. It will aim to reduce the avoidable use of bed-based care, whether that be in hospital or the community via care homes, and will aim to achieve better value for money through addressing the points outlined within this report, whilst a new commissioning model for home care is being developed. In terms of next steps, on approval of committee, we will aim to go out to procurement this month with contracts being awarded in November should everything go to plan. Thank you very much.
Thank you very much. So a service we already provide, taking it forward, and a very important one on hospital discharges. Councillor Bowden.
Thank you, Councillor Howard. I read this report with great interest, and I liked what I saw to the extent that I understood it. I get the impression from reading the report that officers have done a great deal of work here in order to provide a redesign of the block provision which will be better than what we've had in the past. I wasn't able fully to translate what we had in the past into what we've got in the future. I just didn't see the links weren't shown clearly enough for me to see that. Having said that, I've got a great deal of trust in the officers that we've got, and I understand the direction of travel they're talking about, so I'm quite confident that they've done the job well. I just can't see it for myself. What I haven't been able to see, for example, is the rationale behind and the numbers behind the rebalancing between single-handed and two-handed calls. I'm sure what officers have done has been right, but we weren't shown the working of that to explain why we've got to where we've got to. And also, I would have loved to have seen, and maybe this is something maybe for future reports, a greater information provided to us about specific anticipated utilisation levels and what the utilisation levels were or are currently in the current system. So having that greater granularity of data showing how we move from where we are now to how it's proposed we be after a system is redesigned, I think would be really helpful to members of this committee so that we can get a better understanding of what happens. But as I say, I can see the direction of travel, I understand who the officers are who have done this, and I've got a great deal of confidence that what is being put forward to us today is the right way of going forward. So I'm very happy to support this.
Thank you. And I think some of that was guidance about future reports as well as specifically this one, but I'm sure the office will answer. I see two more. I don't think we need to have a very long list on this, so I see three more. I'll take Councillor Ambrose-Smith, and I saw two there. Could you just indicate again, Councillor Wilson, and there was a second one there. Yes, Councillor Daunton. So I'll take those three. Councillor Ambrose-Smith first.
Thank you very much. Again, I support this paper. I'm concerned not just with this paper, but all through what we're looking at today, and that's the reliance that we have on the voluntary community, and just wondering how we can actually assess their weaknesses and positive points, because okay, they've done very, very well in this pandemic and so forth, but reliance on it through years to come, I think, is a weakness, and I think we should be able to monitor that in some way.
It's a big issue there. I share your view that it's going to be difficult to keep it going post-COVID at the very high level it's been. I'm not sure it's for this paper, but I think it's a very valid point and has been heard. Let's think about how we deal with it. Councillor Wilson.
Thank you, Chair. I have two questions, please. One, 2.13, the proposal creates an annual underspend of £314,000, which will be used to incentivise providers. I don't really understand what that means. It would be helpful to have a bit more explanation. And the second, my perennial question, what are the implications here for self-funders? Because I'm assuming that this is only for people that we are supporting and not for everybody that might come out of hospital. So if we're talking about trying to make the rounds more environmentally friendly, are we going to try and include work that the providers might be doing for self-funders as well in looking at those rounds? Thank you.
Thank you. And Councillor Daunton, please.
Thank you. So I had two questions, but Councillor Wilson has taken my first question. My second question, I'm afraid, is coming back to this whole notion of place-based. Page 75, what do you mean, what is meant in the report by a place-based provider? Thank you.
Thank you. And one from me. I just think if we're about removing jargon, this is people who, perhaps for reasons of weight or other reasons, need two people to lift them, and we haven't been doing it, and we haven't been doing it well, and now we're going to be. So that, I strongly welcome that. But perhaps that wasn't said quite as openly in the report as it might have been. Will.
Thank you, Chair. So I'll just respond to those comments and questions, if I may, and I'll bring Shauna in on some of those. So in terms of the comments around the rationale for rebalancing and the working not shown, I can assure councillors a fair amount of work has been done around what that might look like. And as part of that analysis, it has become clear that the people being discharged from hospital have higher needs, much higher needs than certainly pre-COVID. So we are seeing the levels of acuity going up, and our and the way, as part of our retendering, is to address that by increasing the amount of double-handed care quite significantly, and having the ability to continue to increase that throughout the contract if we needed to. In terms of the what we've called the underspend, that's so we have an amount of money that has been budgeted to provide this service. That's our estimate of how much money. It's not so much an underspend, although you could argue it's an underspend against what's been budgeted, and we're wanting to use that money to work with the carers, particularly, that are delivering the service, to focus on helping people maintain or regain their independence. And I thought it was important that we put that in the report. There is more work that we need to do around that, and happy to bring that back if it's helpful. In terms of when we talk about place-based, again, I think we've talked about using terms interchangeably. What we're talking specifically about there is actually neighbourhood-based. So we are wanting to change the model of care, whereby we don't have carers who have significant amount of travel, for example, who don't get to spend as much time as we would like with the people, and we're trying to move to a model where we have carers who live and work in their own community, and that they are supported and work with other community teams, be that volunteers, voluntary sector, social workers, the GP, and what have you. So that I hope explains what we meant by that in the report. In terms of self-funders, I don't know, Shauna, if you want to come in on that point.
Absolutely. There's definitely room for it. There's definitely opportunities, I think, available in terms of rationalising routes with the impact of the environment considered, but it's a much larger piece of work that needs to be undertaken. So self-funders can access home care, have the ability to access home care providers outside of our frameworks, outside of our contractual arrangements, if they so wish. So there's work. I think there's opportunities in the future, but there's work we need to undertake with the market, with those providers that may have a contractual relationship with the county council or may not, to understand how that could operate and could be managed without impacting on the capacity available to us at any one time.
Thank you. I think all the questions are answered. So the recommendations are to approve the recommissioning of the block home care.
Could I just come back on that, just to clarify?
Okay, sorry.
The self-funders are going to end up paying a lot more than those that we're providing through these contracts, aren't they? As they are for residential beds and nursing care and the like. Is that correct? And is that something that we are comfortable with?
I don't know which of Will or Shauna wants to answer that. So, are we correct in saying that this service is not made available to self-funders, or is it hospital discharge for everyone? Which is it?
So we are able to deliver the service for people who have...
So the service for discharging we have some universal services. So, for example, our reablement service. For this particular service, these are to support people that are eligible for support.
Right, so this isn't for everyone. So the question from Councillor Wilson applies. Who wants to answer it? How much more are self-funders going to have to pay than what we can provide for the same service?
Costs, we can look into the figures. Costs vary across providers. The County Council can support self-funders to access services from a range of providers, from those using are contracting on our existing rates through to providers who charge more. So an individual has a choice around where they go with that. So they can choose to go to a provider who maybe costs less, or they can choose to go to one that maybe charges a bit more.
Okay, I'm keen not to reopen the debate on this, if you don't mind, Councillor Wilson. It's a very fair point. It will be noted in the minutes, and I think it applies to much more than just the hospital discharge service, so I'm sure we can come back to it. It's a very valid point. I am going to drive us on by putting the recommendations to the meeting to approve the recommissioning of the block home care provision to support hospital discharge on a 2+1+1+1 year basis at a value of £10,120,280 over 5 years, and to delegate approval of award and extension periods to the Executive Director of People and Communities. I'm seeing nods, am I? Yes, I am. That is agreed by consensus. And I will drive us on to point 9, Independent Living, Princess of Wales Development Outline Business Case. That's on pages 83 to 100. Is Gurdurf Singh here again, who I don't know? Brilliant. So Gurdurf is the Head of Commissioning for Commercial. You're very welcome, and we look forward to your report.
Thank you, Councillor Howitt, and good morning, committee.
Thank you, Chair. If I could just ask, and I'm sure on behalf of a few other people, when you are planning for a comfort break?
I can, if asked, put a comfort break in, but I wasn't going to plan for one. I was hoping people would just slip out and slip back in.
That's not democratic if you slip out and slip in and then join the debate again. You need to be here for the debate, so I think
Can I
it'd be
just
right.
check with our Democratic Services colleagues, is there a uniform practice in other committees on this?
I think it would be probably preferable to break for...
No, in other committees. I'm just asking you, is there a uniform practice on whether there are comfort breaks or not in meetings?
Usually a chair would, the convention is that they will break.
Have a break. So that's fine. I think now is the time. And so thank you for drawing it to my attention. And we'll resume in 5 to 10 minutes. Thank you for being so speedy. That's really helped us. So item 9, independent living, Princess of Wales Development Outline Business Case. Gurdev Singh, please.
Thank you, Councillor Howitt, and good afternoon, committee.
And do you mind again, just like Shona, just turning the microphone to your mouth and getting really quite close to it, just so that you're well heard? Thank you.
Certainly, hopefully that's a little clearer now. Thank you. The report in the pack today outlines a business case which will lead to a final version next year, and I seek committee's approval on that and the recommendations in particular, and I ask them to note the further advice sought from the Strategy and Resources Committee. The report itself provides details of a new service, a new capability in the care market which should deliver strong financial and social benefits. Looking deeper, it's about offering people with high levels of needs with ways to retain independence by flexing and wrapping care services around their particular needs. A lot of work has just started and will continue during late spring and early summer in consulting with user groups, individuals and representatives about the details and the fine work that we require to do to finalise specifications. The report also highlights there is a signal to the care market that what people want is more tenancy-based services which are effectively homes for life for this particular group that we're looking at, that are self-contained and digitally enabled. And to accelerate this approach, we seek this particular business case to move forward. It is, I should ask committee to note, not unique and new completely. There is something like 700 tenants already in similar sorts of services down in Kent, and there are work being done in the West Midlands exploring the same ideas. What's really exciting about this particular piece of work is we can do this collaboratively with the NHS, adjacent to a new care service in the midst of a major housing development in North Ely. The NHS themselves are at a similar stage to where we are in their progress and seeking final approvals as well. The report also details how the two programs are linked, particularly during this next phase. By way of implementation, we've structured it such that we will take control as an authority of the financing and building of the services, and we are seeking to outsource the care and the housing. The reason for that is both the care and the housing market are highly regulated, and we need both the capacity and the experience of providers to achieve the best results. But we can limit the level of work there by putting in place long-term contracts, which effectively gives us, as an authority, effective control. And finally, the actual business case predicts a range of benefits, including cashable, employment, and social benefits, and proposal 3, which is the one I'm commending, also achieves all the strategic objectives. I welcome comments from the committee.
Thank you. This is obviously a big project, but this is just one stepping stone, an important one along the way. Who would like to ask questions or make comments, please? Councillor Baird.
Thank you, Chair. I'd just like to say it's a great report, and I'm really pleased that we're looking at trying to make people live independently, carry on their life as normal, and I think it's a great idea. So thank you very much.
Thank you, Chair. Thank you very much, Councillor Baird. Councillor Bowden.
Thank you, Councillor Howard. I particularly welcome this proposal, which has been a long time in the making, I have to say. It seems to have been being discussed for a very long time, and it's something which I've had some experience on, as has Councillor Goldsack on the Commercial and Investment Committee previously, when we looked at the business case for this. What particularly appeals to me about this is the fact that it puts people first. It puts the patient first. And that is so important in any provision which is made. And all too often, we find ourselves in positions, especially within the health service, I have to say, of people having to fit in the system rather than creating a system that the people will be able to thrive in and be able to have their needs placed in the centre. So I'm very pleased with it. I do have a couple of questions. I do hope, first of all, that this will be rolled out further around the county beyond this case and the second case. I'm hoping it's going to be able to be rolled out further, because I believe it makes both financial sense and it makes personal sense for the individuals concerned. A couple of questions that I've got. The first is, in paragraphs 2.6.6 and 2.6.7, we see both controllable and uncontrollable risks are mentioned. There is some quantification about the potential value of those risks. And we're also told about the forecast lifetime benefit of the scheme of £5.7 million. We've almost got enough dots there to be joined up to do sensitivity analysis, but not quite. And I just wonder if, when we get to the full business case on this, and also future outline business cases, if we can have a clearer sensitivity analysis shown, so that we don't have to try and do the maths ourselves and try and work out just what the risks are so far as sensitivity analysis is concerned when it comes to making a decision. The second question I have is to do with the social and other financial value there is contained within the 5.7 million which is mentioned. We're told that there is £5.7 million of, in present-day terms, which I appreciate, in present-day terms, £5.7 million of lifetime benefit for this scheme. And of that 5.7 million, we're told that 3.6 million has a financial value, meaning that 2.1 million has a social or other value. And I wonder if we could have slightly more information about how that 2.1 million is actually made up and how it's calculated. I personally find that fascinating, how you calculate the value of non-monetary items such as that, and I'd very much welcome some further information on that. Thank you very much indeed.
Thank you. I loved reading that about social value in the report, and I know that's something that we could put even more emphasis on. I don't see any other hands, do I? I do. Councillor Dupre.
I apologise, it was me. Firstly, I want to say I absolutely support the principle of this. Secondly, I don't want to impinge on something which is ultimately a planning matter, but I do think it's important that at this stage we put down a marker that this proposal, this scheme, needs to be a good neighbour. And I put it in those terms because I think there are a number of highways and transport issues that will be critical to how this is viewed locally. The reference is made in the document to a bus stop, and I think, you know, it's been one of the great disappointments in my life that just because you build a bus stop doesn't mean that a bus will turn up to it. We need to make sure that that happens, and that needs to be a concerted effort with the combined authority to work on ensuring that there is good public transport to this provision and to the other elements of the site, including the housing that is growing on that site and also the redeveloped hospital. I think also we need to ensure that there is good provision for active travel to and through the site by bike and on foot. And I also think that we need to ensure that the traffic arrangements to cope with the increased number of vehicles in and out of the site for this and the other purposes on that now multi-use site that growth is coped with effectively. So I do want this to be a good neighbour. I realise that those are planning issues and not a matter for this committee and this paper, but I do think we need to be putting down markers early that a lot of work needs to be done by our highways and transport colleagues and the combined authority to make sure that this is a good neighbour and that the scheme is a success.
I'm sure that could be put in the minutes, and it's a good point. Councillor Hay, please.
Thank you, Chair. There's a lot of ifs when it comes to the risks, but one of the ifs, if you like, under revenue related, I'm very concerned about. It says, if the care building planning classification is wrong, then tenants will not get access to all their benefits. Who actually, I'd like to understand more, who actually sets out the classification? And, you know, when they say is wrong, I'd like just a bit more meat on the bones of that statement.
Those are all the hands. A couple from me. There's clearly a housing shortfall of this type across the county, not just in East Cambridgeshire. I agree with what was said earlier about that. So, but this is quite a big scheme. You know, probably to actually get another one of this size is going to be quite hard work. So I don't know if there's any comment about that. The second one is I think we need to be honest with ourselves. There's quite a lot in the finance of this that is a bit risky. And in particular, if you've got the health service having a vacant building, selling some of it, we're renting some of it, and then ultimately providing a service, the proper split between what the health service pays and what the county council pays, this is a really excellent example that that's actually quite a difficult question. But so what I like about this report is that it's not a sort of final yes or no. It's advancing a stage on the project, but I certainly also would want to be much more convinced about the financial outlay and risks. But having said that, I said this to the officers before, they lay out a great deal of due diligence. I know they are doing that, so I don't want to suggest in any way they're not. But I feel that we as members need to be really persuaded of that as this goes forward. Those are the questions. Who's going to come back? Will.
Thank you, Chair. I'll come back with some of that, if I may, and then quickly hand over to Gerda on some of it. So I just want to pick up on the comments around social value and comments around the good neighbour. And I think this is still in very early stages, and we do have huge amounts of work to do, and much of that is around local consultation, particularly. And if agreed, then there will be a plan for significant local consultation. And also, we have indicated in here areas where there might be social value. I would like to add that the next step for us is that we feel that there is more opportunity. We haven't explored that as fully as we would like, and that would also be our intention in the next phase. In terms of question about more of these, I have to say that this is for us a really exciting and significant move away from our what we would term our normal or our standard residential based care. We think this is really exciting. It gives people huge amounts of choice and control, and I suppose, you know, as part of this is we are certainly indicating, and we're certainly indicating to our independent providers, that this is our direction of travel going forward, and I just think it's important to make that point. Gerda, if you want to just very quickly talk about the lifetime benefit and the sensitivity analysis, that would be helpful, if I may.
Thank you, yes. Just by way of context as well, there is further information going to the Strategy and Resources Committee, which has a very large section on sensitivity analysis and how all the details behind the social and financial values have been calculated. I elected at this stage not to present it to this committee, so if it's my omission, I apologise for that. But I focused here on the strategy and on the care aspects, more so than the financial aspects. But I'm more than happy to bring that additional information back to this committee, should this committee wish to. If I may also add 2 points on the travel planning aspect. The NHS's business case has received East Cambs District Council planning approval, which included a comprehensive travel plan analysis. Our piece of work starts now, which will build on that analysis work itself. So I'm confident ours should also be as successful without having a significant impact, adverse impact to the local community. And the final point, if I may add, is on the risks as a whole. What we felt was, certainly at the very early stages of a program, there's always going to be risks, and we listed as many as we could. We didn't quantify all the risks in terms of the likelihood of them occurring, but certainly the severity if it occurred. As we go through a program, we start working off those risks and reducing them and mitigating them, or even cancelling them altogether. In the case of the planning application, typically services of this type fall into one of two categories. normally, and we would expect so at the next stage, it will revert into the category we're expecting, but I've just put the worst case scenario down, just so that members are aware, very transparently, all the potentials that could or might occur.
Thank you. It's got to be very short.
Thank you very much indeed, Councillor Howard. And yes, we do sometimes need to come back to what officers say because it helps in order to progress what it is that we're trying to put across. I very much welcome the comments which have been made. I would suggest as a matter of principle that this committee should be given more information, the necessary amount of information about finances, including sensitivity analysis, because we shouldn't be relying upon policy and, strategy and resources to do it. Now, I happen to be on strategy and resources, and I look forward next week to looking at this and quite possibly having a discussion about it. But it should be for this committee to see that as well, in my opinion. And I'd just like to make that point to you in general terms, not specifically relating to this item, for the future. Thank you.
Yeah, that's a very fair comment. The only thing I would say is really we want shorter reports and in more plain English. So I encourage the officers to use appendices. I think it's a completely fair request, but to use appendices to present some of this material so that people can get to grips with the report. So this set of reports, they're really quite lengthy. And so I don't want to send a mixed message to officers on that, so I will say that.
May I just agree with you? As long as the information is given, if it's given in an appendix, that's perfectly okay.
Thank you. I have to read out recommendations, as everyone knows, because we're live streamed and people don't have the papers in front of them. I will now move them. We're being asked to give approval to the proposed design principles employed for independent living services, as set out in paragraph 2.23. To put in place a formal agreement between the NHS, Cambridgeshire County Council and a housing management provider about ways of working. The benefits of this outline business case stage which affect adult social care operating budgets, the general procurement approach for a contract value of £72.6 million and to procure and sign agreement with a housing management provider and a care provider and delegate the award of the new contract to the Executive Director of People and Communities. I'm just seeing if I have to read a little bit more. Give me a second. To note and comment on which we've done, but I have to read it out. The plan to invite the Strategy and Resources Committee to approve a recommended option as set out in paragraph 2.5.6 and its financial and social justification, the overall capital investment case and in particular elements which affect land and property and the monies required for the next stage, an additional capital provision in the 21-22 business plan as set out in paragraph 1.8 to delegate approval and sign off of the inter-authority agreement and the non-binding heads of terms to the Chief Financial Officer and the Commissioning Services Director and to prepare and submit a planning application for the construction works. To note and comment on the final financial investment forecast, including the initial land valuation and plans to refresh both, the revised timetable and preparations on the concept and detailed design and co-production and consequently move towards the full business case. So this is a interim business case moving towards a full business case is a short way of putting it. Everyone happy with that? Any objections of any kind? No, I'm seeing agreement all around the room, so that is agreed. Next, item 10, procurement of housing-related support services. This is pages 101 to 112 of the agenda pack. And we have Lisa Sparks here. You're very welcome. And you're Commissioning Manager of Housing-Related Support. Lisa.
Thank you. I'll just briefly go through the paper. In terms of the recommendations, we're asking the committee to agree the proposed procurement approach today, to also approve the recommissioning of services for a 7-year period and a value of £11 million, and to agree to delegate responsibility to award the contract to the Executive Director of People and Communities. A review of housing-related support services was undertaken in 2018. One of the key recommendations from this was to consider redesigning housing-related support services for homeless adults and young people. The currently commissioned services are shown at 2.1 in the paper. Nearly all of these services have been in place for many years. The majority are based around a traditional hostel model. Whilst services do deliver good outcomes for a number of clients, they don't actually cater for individuals whose needs mean they're not suited to a hostel environment. With the new model, what we're looking to do is to change so that we've got a mix of accommodation. So the proposed new model has been developed in partnership with providers, partners, clients, and with input from a dedicated member reference group. It also provides us with an opportunity for joint commissioning with public health colleagues and Cambridge City Council. So the new model seeks to move towards a more community-based approach through adapting what we're referring to as a hub and spoke model, which will mean delivering a mix of larger staffed units and smaller community accommodation for people. Those smaller units can then be used flexibly, both as an alternative to hostel accommodation and to provide community-based opportunities for people who are needing reducing support over time as their needs reduce. In delivering the new approach, we'll be able to meet some of the identified gaps from the review and deliver the vision and priorities in the housing-related support strategy. Alongside the hub and spoke approach, the County Council would continue to deliver a housing first offer for those people with multiple disadvantage who frequently struggle to manage in a hostel or shared house setting. And to support the ongoing delivery of that housing first offer, we are seeking to use some of the current housing related support funding as detailed at 2.16. In terms of procurement, we'll be focusing around 2 lots, one for City and South and one for Fenland. The City procurement approach will be to jointly commission what we're calling a new streets to home service with City Council and Public Health. And we're proposing a contract period of up to 7 years, and that's to reflect the level of change that we're expecting from this redesign work. Proposed funding for each lot is set out at 2.26 in the paper, along with the amount that Cambridge City have committed, and I must admit there's an error there. I'd just like to point out that the wording states that the funding from Cambridge City Council will be going to Lot 1 rather than Lot 2, which is what it should do. At the moment it reads as if it's going to Fenland District Council, and that is an error. Given the scale of the change, we're expecting the new models to deliver a significant, or to require a delivery of a significant transition period. So what we will be doing is ensuring that there's a transition plan agreed at the point of contract award. Does anyone have any questions?
Thank you very much indeed. There would be some people, I think, who should feel that Cambridge should subsidise Fenland, but I think we'll not deal with that one today. Really interesting area again about dealing with homeless people and helping them to move on. Any questions or comments from members? Please, Councillor Daunton.
Thank you, Chairman. I'm looking at page 108 and the paragraph which begins encourage partnership working. And you say in this paragraph that in several areas providers are already having discussions about how they might deliver the model jointly. Can you just give us a little bit more information on that?
Anyone else? I'm going to just go up the line. Sorry, I'm trying to call people in a different order so everyone gets a good chance to speak. So I'm going to start with Councillor Goldsack next.
Thank you, Chairman. My question is two-part. Had the pleasure this morning of driving in, parking at what was Shire Hall and walking into town. I was obviously perturbed by the amount of rough sleepers that I could see walking through the city. And through the pandemic, it's the first time I've been into the city of Cambridge for nigh on 18 months. So that really did struck home to me. So this is a very timely paper to then read. The question I've got is, it's not a numbered thing, but on page 103, your table below details the HRS services. I see the same names coming up time and time again, and that's obvious. But, you know, these are also applicants for Innovate and Cultivate funds regularly. And something that's often accused is that we work in silos and we don't work across the way. Can I have some officer support and comfort, please, that we do work across the way and keep an eye on the amount of monies that's going to any one organisation, so that it's absolutely fair and equitable.
Councillor Bowden, please.
Thank you, Councillor Howard. I very much welcome this report as well, I'm pleased to say. Again, it's building on what has been put before the committee previously. I do have the concern that hostel accommodation hasn't always been appropriate in the past. A very great deal of money is spent to do with homeless adults who have support needs, and I'm not always convinced that in the past we have achieved the results from that large amount of money that we might have hoped for. I think that making this more focused on the needs of the individual, which the Housing First model really does, I think that that will be far better, and I'm pleased to see the Housing First model being effectively expanded by the proposals that we have here. I'm a little bit surprised, and I hear the comment made by the officer about it being a 7-year contract, and I would hope that that 7-year contract would have some break clauses within it, because it does seem to be an awfully long time to enter into a contract without the opportunity to reflect and possibly change if it turns out that it's necessary to do so. I'm grateful also to the officer for explaining that the reference in paragraph 2.26 to lot 1 should have been a reference to lot 2. But it still leaves paragraph 2.26 stating that Cambridge City will be investing, and I'll do it in round numbers, will be investing 496,000 in the Streets to Home service, of which 371,000 will form part of the lot 2 annual budget. What is the other 125,000? So those are my two questions. 7 years with a break, and secondly, what's the other 125,000? Thank you.
I'm going to resist the temptation to make a joke that you won't win the next election either, so it doesn't matter if it's 7 years. But I suspect you won't find that funny, so I'll resist the temptation. Any other members? Councillor Bird.
Thank you very much for the report. As we know, in the City Council, we do help a lot of the rough sleepers, but some of them don't want the help. You can only do so much, so that's a big problem for us. But we have done 60 modular homes. If you get a chance to go and look at one, they're fantastic. So we've managed to get 16 homeless people into their own accommodation and then move on to get a proper council house. So that is important. So we are working hard, and I really enjoy this report, reading it. And it is sad to see the rough sleepers, but we're getting there. So if anybody's got any land anywhere that they could put some modular homes in, let us know, because we'll fill the spot up. So that's an important thing. Thank you very much.
Thank you. And Councillor Ambrose Smith, please.
Thank you, Chair. Thank you, Chair. Just some clarification, please, on page 119, spend by district. You've got a green segment there called county-wide, and I just wonder if that is wrongly designated. If you could come back to us on that. The other point is regarding this and the problems individuals have with drink, drugs, and mental health. Well, that's well known, but what is the understanding? What understanding is there on food banks and the use of the individuals and the reliance on food banks? Because I think if we think deeper, that's a big problem in keeping in your own home and keeping alive. Thank you.
Thanks, that's all the members. Thank you for that. One from me, and I'm sorry if I've missed it, but have Fenland Council been asked to make a contribution? It's obviously very welcome to see that contribution from Cambridge City Council, but were Fenland asked to do that, and what was the response from them? So Lisa again to answer the questions.
Okay, so in terms of the question asked about partners, about providers delivering in partnership, we've done an awful lot of capacity work with providers, so they've been very involved in delivering the model. We've indicated quite early on that we're looking to have lots per area, but that we would welcome partnership approaches, and that we felt that there was a lot of value that would come from people working together. I'm pleased to say that that seems to have worked for the young people's tender. Certainly we've had partnership bids from existing providers in the area, and we're very hopeful that the same will happen with the adults as well. So we've given them plenty of indication, and we are aware that there are already discussions happening between local providers. In terms of the 7-year contract period, yes, there are break clauses. We're looking at 3+2+2. There'll also be a review of how that service is doing, and we're ensuring that there's flexibility within the contract so that we can make changes to the service as we move through that period, so that we're not wedded to something that potentially either isn't working or needs to evolve over that time period. The other 125,000 in the Cambridge City figure, that is funding that Cambridge City provide directly to CPFT for the dual diagnosis street partnership, which is which has the sort of mental health substance misuse focus. That is a clinical service, and that will continue to be commissioned directly, but will be part of that model. The section around county-wide spend, that relates to our large-scale floating support service, which is delivered by P3 across the county, and that specialises in supporting adults who are at risk of homelessness, and that includes people in their own homes, in social housing, and also to help settle people into new tenancies if they've been homeless. In terms of the contribution for Fenland, there hasn't been the same discussion with Fenland, and that's because what we've developed with Cambridge City is around a whole offer, aligning the funding from both parties. So rather than us both kind of funding disparate things that are kind of doing the same thing, we had a much earlier conversation about trying to bring it all together to make it work much more efficiently and effectively for the customers on the ground. So it's very much about Cambridge City using existing funding that they've got. I don't believe that Fenland have that kind of funding available at the moment, but we've certainly indicated to Fenland that we'd be quite happy to talk to them about some sort of joint commissioning arrangements in future if they wanted to go down that route.
Thank you very much. Could the point about 3+2+2 go in the minutes, please? Because I think that was an important point raised by Councillor Bowden. Again, it has to be very quick because we've heard the officer.
It's very quick. We have homeless people in Huntingdonshire, and there's quite a lot of money spent in Huntingdonshire. I just wanted to clarify why, unless I missed it, there's no proposal for contract spend in Hunts.
Fair question, Lisa?
So the lot values are based on existing need and demand and spend. However, in terms of Huntingdonshire, we're aware, for example, that there's been an increase in rough sleepers since the COVID pandemic. And part of the funding that we get from central government currently for the Housing First service means that we'll now be able to offer a dedicated post in Huntingdonshire to start working with those individuals. So that should continue as the Housing First model continues with the funding that's allocated.
But Chair, are we going to provide any accommodation as we are elsewhere?
Can perhaps this be part of a future report? I think it's the question put again, minute it please. But perhaps that could be part of a future report. Okay, I'm going to have to read the recommendations out, which are to A, agree the proposed procurement approach, B, approve the recommissioning of housing-related support services for homeless adults with support needs for a contract period of 7 years, 3+2+2, at a total value of £11,069,695, and agree to delegate responsibility to the award of the contract to the Executive Director of People and Communities. Are people generally happy with that? Yes, I'm seeing nods all around the room, so that is agreed. We now move to healthy weight. Item 11. It's the report is on pages 143 to 158 of the agenda. Val again, please.
Thank you, Councillor Howard. Just before I start to talk to the paper, I think we use the term obesity and healthy weight. And the term healthy weight is used in the paper basically because of the associated stigma with the word obesity, and also it allows the whole spectrum of weight, because obviously there's a lot of focus on obesity, but there's also evidence that we have malnutrition in the population as well, particularly amongst our older population. So hence, we've used the terminology healthy weight throughout the paper. The committee is asked to endorse and support a range of proposals. Firstly, the outlined strategic framework for healthy weight, a time-limited review of the barriers and enablers for addressing healthy weight locally, support engaging system leaders in adopting the framework, and in view of the COVID pandemic and the effect it's had on those who are experiencing unhealthy weight, specifically obesity in this particular situation, we do know that they do experience very poor outcomes, people that are obese. So there is a need for some targeted work at the moment, which in fact had been planned for January with the CCG, but unfortunately our surge of COVID at that time put a pause on that. I think the paper details the impacts of obesity, the health impacts, short, medium and long term, and then the knock-on effects on health and social care services. And also it is very much associated with health inequalities. We see higher rates of unhealthy weight and obesity in more deprived areas. But I will make the observation that over 60% of the population of Cambridgeshire have a weight that's deemed unhealthy. That's quite a substantial proportion. So even though we compare quite positively to national figures, when we look at obesity, that's still a very large proportion of the population that have an unhealthy weight and everything that goes with that. The other, I think, characteristic when talking about weight is that it's so multifactorial. It's not one thing that's going to really do anything. It really does call for a system-wide approach. And I think the report draws attention to the Foresight report, which is kind of the seminal report around obesity and the need for a system-wide approach. More recent interpretation of the report also acknowledges that some people, there are certain genetic predispositions as well, which doesn't get away from the fact that I think there's still that whole social and economic determinants play a key part in it. I think we've, certainly in my working life, I've seen so many initiatives that do address healthy weight, and I think it's always been sort of almost piecemeal. I think for me, the COVID experience has really brought a lot of collaborative effort. And then I think we've just discussed in an earlier paper the ICS system. And I think those two things have produced a climate when perhaps we can really exploit the opportunities which COVID has afforded, and really sort of get to grips with taking a system-wide, a more granular, in-depth, system-wide approach to healthy weight, and perhaps be able to make those changes that we can have progress in it, because it really is about, I think, the most challenging public health, the most challenging public health topic on our agenda. And I think one might say COVID is, but I think we're all hoping we can see an end to COVID. I think it's going to be a more of a longer struggle in a battle against obesity and healthy weight in general.
Thank you very much. An excellent report. Who would like to speak? Councillor Wilson.
It worries me when we talk about healthy weight if we only mean obesity, because we're not talking in this paper about anorexia. And that is a mental health condition which I think is just almost as serious for those people affected as obesity. But sticking to obesity, there's a lot that I think the council should be doing on education in schools and influencing what goes on there. And it's a pity that this particular item wasn't discussed with the district folk, because the district planners have an awful lot of influence over fast food outlets and where they go and whether they're placed close to schools and the like. So I think that this is one of the topics that needs to be discussed in the round with districts and other partners.
Thank you. Councillor Van der Ven.
Thank you. I just wanted to ask whether in the chart that you've got that gives us that strategic approach, while the text afterward does talk about physical activity, given that that's such an important component of this issue, if that could be spelled out more explicitly in the whole system approach chart. I feel I know what you mean, but I want to see it out there really promoted in all of its forms, or as, you know, more strongly. And thank you.
Councillor Bowden, please.
Thank you, Councillor Howard. This is a very interesting and very difficult subject. And I have to say that Val Thomas will remember that I've had a few conversations in Health Committee over the years about this subject in particular, because it's a particularly difficult area for us to measure the effects of what it is that we try to do. As Val said, it is very much a multifactorial problem. And that actually means that it can sometimes feel as though, to the extent that we are making interventions, we are throwing money at the problem, and we're not easily able either to assess in advance what would achieve success as far as that money is concerned, nor are we able to measure the effect of that particular money afterwards, because there are so many other factors which are involved. It's a general problem that there can be, of course, in public health, but it's a particular problem, I think, so far as healthy weight is concerned, and it's something that we do need to recognise. Now, I do appreciate that this paper is about the strategic framework rather than about specific programmes, but I think that we need to be realistic about this, and we also need to have our eyes open when we are making decisions about programmes to ensure that there is some degree of objectivity here and some degree of prescience as to what it is we are trying to achieve and whether it is measurable in order to justify what it is that we do. Now, that's not to say that I'm in any way disagreeing with the need. I fully accept both the whole system and the individual problems and costs which are associated with obesity. I fully understand all of that. But I do think that it's an area we've got to be exceptionally careful about. And I know that I have had the conversation with Val Thomas about this, but we need, in spending the relatively limited amount of money that we do have within the public health budget, we need to be really as focused as we can on getting specific and well-defined results. Thank you.
Councillor Slatter, please.
Thank you. Apologies if I missed it, but I didn't see anything here that referred to the practitioners in the form of the commercial firms, such as Weight Watchers, who have been developing the most extraordinary range of innovative methods during lockdown. I've seen this happen in my extended family, where people who've struggled with their weight for years managed to go to, St. James of Compostela, on a sort of virtual pilgrimage, egged on by virtual colleagues, and maybe then avoiding some of the embarrassment that is involved in jogging down the street in public, but actually discovering there was a lot of things they could do in their own home in order to get this. Now, I'm aware that these are commercial projects, but there's a lot to learn from them, and the online and virtual encouragement of these groups has, I think, been quite extraordinary in some cases. It's not just the exercise routines we've seen happen through the BBC, but these specifically driving at obesity and weight loss. They are some real experts, and I didn't know whether we'd been talking to them or picking their brains. Thank you.
I think that might be in the report, actually, but I'll let Val answer. I don't think we've got more questions, so Val. Microphone, please.
Sorry. Yes, welcome the comments about the importance of the districts and the planning authorities, and it does sort of is an example of where we need the whole system, that it isn't just something public health with our limited budget, as Councillor Bowden says, and I think
the paper is more about that wider strategic approach. But I also think we now have an awful lot of evidence around what works with interventions, that we can use the public health budget very judiciously. So, and I would welcome, certainly in terms of any services that we commission should go through that very rigorous scrutiny. In terms of the commercial services, I think it's in one of the appendices describes what we do at the moment, and we do commission a lifestyle service, and they subcontract with 2 commercial services, in fact, that provide, and throughout the COVID they have provided a virtual service as well, but they couldn't do anything else effectively. So yes, we do, and I think they have been quite well evaluated as well, the services that we use. In different aspects of the we have commercial input from companies in various types of weight management services as well.
Apologies if I missed the appendix. I'll go and read it at home.
There's a lot of apologies today as well, which is very nice, but perhaps not what I don't think necessarily justified. I'm going to read the recommendations. To A, endorse the outlined strategic framework for healthy weight. B, to endorse a time-limited review of the barriers and enablers for addressing healthy weight locally. C, support in engaging system leaders in adopting the healthy weight framework and the learning from the review. And D, support the delivery of an immediate programme of awareness and campaign targeting those most at risk of poor outcomes from COVID-19 that are associated with obesity. And I did think Councillor Wilson made a very good point about anorexia as well, so perhaps that could be recorded in the minutes as well. Are people happy with those recommendations? Yeah, again, I'm seeing a lot of support, so thank you very much. Thank you, Val. We've got 2 items now, which are just to make sure that we note urgent action that was taken by the Chief Executive in the election period when we weren't meeting. The first one is item 12, additional grant funding for drug and alcohol treatment services. That's pages 159 to 164. Val again, please.
Thank you. I've got my microphone on this time, I've remembered. Yes, these grants that have come from MHCLG and from Public Health England, I think for the opportunity to our communities of vulnerable communities, great opportunities in the wake of COVID in terms of rough sleepers and offenders who are probably some of our communities that have the poorest health outcomes. The total of the bids are over 1 million. The reason why we asked for the Chief Executive's decision is that it was very unsure when we first started to hear that we were getting additional funding, what the full amount would be. And it took a few months to establish that it was going to be of this value. And of course, once it exceeds £500,000, it then becomes a committee decision. This value didn't become apparent until we were into the election period. And consequently, initially this meeting was going to be in July as well. Consequently, we felt that we needed to commence these services, these additional services, which I think, as I described just now, are very important in terms of this particular vulnerable group. We did ask for a Chief Executive decision, and also there was an expectation from the funders that we would start as soon as possible. So that was the rationale for asking for the Chief Executive's decision.
Any questions or comments? Councillor Bowden?
Thank you, Councillor Howard. First of all, I'd like to make it clear that although I have a slight technical issue, which I'm not going to raise, but I'm supportive of the decision which has been made in principle. Having said that, the governance surrounding this decision has been, to be quite honest, appalling. And I know that you said that you're not so concerned about governance issues, but good governance is important in achieving good outcomes in any organisation. I'm actually sorry to have been proven right so quickly following the Council's annual meeting last month in Duxford, when I said back then that there would be problems in deprioritising health as the Lib Dem administration has currently done. Because had there not been a change of administration, this matter would have been dealt with at the first meeting of the Adults Committee, no decision notice would have been needed, and we would have had the opportunity to consider whether it was appropriate to ignore the first break clause, or next break clause, which is available, break time on the 31st of March 2022 for CGL. As it is, there has been no opportunity for us to do that. But it's worse than that, because this decision wasn't just made without democratic oversight, it was also made quite chaotically. And I've got two questions to ask you, if I may, Councillor Howard, about this. But just for those members who may not be aware of what happened, these grants were largely set by central government, and we were aware of them in March and in April. But it wasn't until almost 8 p.m. on the Friday evening before the last bank holiday weekend of all times that a pre-decision email was circulated by the under the Chief Executive's name. Now, the way in which Chief Executive decision notices are made, or it doesn't have to be the Chief Executive, it can be a lower figure, but the way they're made is that if at all possible, and it's not always possible, but if it is possible, then the decision maker has to consult, is meant to consult with the leaders of each of the four groups, together with the chair and vice chair of the relevant committee. And in this case, something which was sent out, as I say, late in the evening, just as a bank holiday weekend was beginning, it produced no results back from the relevant individuals, causing the Chief Executive to issue the decision notice, on the grounds that, hearing nothing back, you'd suggest there was no problem and silence was deemed to be consent. But what actually happened was that the decision notice wasn't sent to the leader, or rather the draft decision notice wasn't sent to the leader of the independent group. It wasn't sent to the leader of the Labour group. It was sent to the leader of the Lib Dem group, but to a wrong email address which she wasn't using yet. And it was sent to the leader of the Conservative group, but of course at that time he was actually taking a short break on the bank holiday, and he didn't receive the email, didn't see the email until after the decision notice had actually been made. You, Councillor Howard, were on holiday, and everyone's entitled to a holiday, and I'm not criticising you for that, but that's the reason why you didn't see the draft decision notice which was sent out, and unfortunately it wasn't at that time sent out, I believe, to the Vice Chair of the committee, as it should have been. So that's poor governance to start off with. But the actual draft decision notice which was sent out at that time was really produced in a less than perfect way, let's put it that way. There were a number of mistakes within it, which were really quite regrettable. Yet because no one responded, largely because most people weren't even told about it who should have been, the decision notice was issued. After Councillor Count was caught up with his emails and started making representations about all of these matters, astonishingly, it was necessary for the Chief Executive to rescind the decision notice, which had already been posted on the County Council website, and then further consultation took place, which resulted subsequently in the current decision notice being posted, which I have to say is a lot clearer than the previous decision notice was, and is to be welcomed. But that doesn't alter the fact that this whole process has happened in a really chaotic and unsatisfactory way. Now, CGL were already advertising to fill the necessary new positions well before even the pre-decision emails were sent. That's another example of how the governance of the whole issue just hasn't been operating in the way in which one could expect. And we were told, because this decision notice was only made earlier this month, we were told that it wasn't possible to wait an additional 18 days to bring this decision before the committee today. Now, I think it's astounding that this decision was made and then had to be unmade and then had to be made again. I've not come across this before in Cambridgeshire County Council, and the only places I've come across it before in other councils is to do with planning where it's ended up in the courts. Although I'm not suggesting for one second this was done illegally. It's been done fully within the rules of the council. But given that we now only have one meeting every 3 months, I have to ask you, Councillor Howard, what action will you take to ensure that this chaos won't be repeated in future? Because unfortunately we're in a situation where government monies are being made available on very short notice sometimes, and we can't have officers waiting around 3 months to bring something to a committee for the committee to decide. So I'm fear that we're going to have more decision notices being issued in the future without the democratic oversight, but it's essential that if that happens, proper governance procedures are followed. And secondly,
You're at your 5 minutes, very briefly, please.
Secondly, can you just give me an assurance that the 31/3/23 break in the CGL contract will be subject to the scrutiny of this committee if that's needed? Thank you.
Okay, I don't think it's fair on the officers to ask them to comment on all of that, and the questions were put to me, so let me make some short comments. I'm hoping that we can go beyond playing politics over the committee structure. I think there was a very fair and proper debate at the annual council, but I think it should end there. We've come to a decision as an authority, and I think it's incumbent on all of us to make the best of that decision, as I fervently believe it's in the public interest. I will defend Councillor Bowden's right to scrutinise, argue and criticise. It's absolutely your right to do so as opposition spoke in this committee. But my first reaction to say this is about services to people suffering drugs and alcohol problems. Right? They were nowhere in anything that was said. And it's a rather important and vital service to people who are struggling. And I would much prefer to talk about the focus of the service. When it said, I think misquoted and out of context about what I said on governance, I think in our reports, if we only have governance and not impact on people, it's wrong. And that was a discussion we had earlier, in which was also acknowledged by the officer. That's not to say that governance isn't important. And so I think it is helpful in this committee if everyone doesn't misquote and quote out of context. And we've also heard that the decision that was taken was within the rules, according to the speech I've just listened to. So my first response is, this is a disproportionate intervention. I don't accept chaos at all. What has happened is that there are new members with new email addresses, and some of the officers didn't get it right. This is an honest mistake. The Vice Chair and me are left on the front page of the papers for today's committee meeting. Is that chaos? Is that terrible? It's an honest mistake. And I think where you get new people, I would expect sympathy and support for our officers in relation to that. It would be helpful if there are going to be political attacks. It's not a Lib Dem administration. It's an administration jointly between the Lib Dems, Labour and the Independents. And again, that rather suggests that this is not about dealing with the issue, but about playing politics. I think that we should all enter into the new arrangements constructively. Will there be other occasions where the length of period between committee meetings causes this problem? Let's all see that in good spirit. And if it is, let's be prepared to discuss it in a friendly and open fashion. We've got reserve days as well, so I think that's something, it's a proper question to put, but I don't see that as a problem. I'm very happy to support the idea that the review clause comes to committee and for that to go in the minutes. I think that's a very fair and proper things to ask for, given the background. But the final thing I want to say is this. This is about this authority getting national funding to get more services to the people we stand for. And a concern that many people have had that the former administration didn't do that enough and didn't maximise the resources we could get. And if our officers missed an opportunity to get national funding because it needed to go to the chief executive rather than the committee, I would be far more worried than our officers spotting an opportunity to improve a service and actually getting hold of it. So I respect what was said by the opposition, but with due respect to them, I reject it. Any other members who wish to speak? None of that was personal about you.
You made a comment about me. I would like to respond.
Any other members? I'm ruling that I didn't make a personal comment, so there's no reason personally to reply. I will take, though, Councillor Goldsack.
Thank you, Chairman. I have to say I take a little bit of offence of what you've just said and not allowed Councillor Bowden to come back in. But the point I would like to raise is earlier in the debate there was a personal attack on one of our members, my good colleague Councillor Hay. An apology was asked through the chair and it wasn't forthcoming. And now we're finding this and we're being told not to play politics. I think, come on, I think we need to be very balanced and very even here in as much as, you know, somebody has made an accusation to somebody on this side of the floor not reading documents, and that was brushed under the carpet on the effect that, you know, it's an alliance. Yet now it's being playing politics. I think, come on, if we're going to be ever open, which I think we've had some pretty good debate this morning, and I think if it's going to be that way, then it needs to be very fair, Mr. Chairman, and not just at your behest and your say-so.
I agree it should be very fair, and I believe it has been. Any other members? I don't ask the officer to respond to all the points because some of them were clearly a debate between politicians, but is there anything that you'd like to add from a more factual point of view that might assist the committee?
I think you covered most of the points. I think in terms of the commissioning point, that was not the key issue in it because we could still do that break clause. It does not mean that we can't use break clause at the end of this financial year. It was put into the paper because it was felt that it would be unlikely given the performance of CGL to date. They've met all their metrics and they are a very, very good provider and produce some good outcomes. So it would be unlikely that the recommendation that I would give as a commissioner that we would not extend the contract, but it wouldn't mean that we could activate the break.
Thank you. I'll take a vote as there has been some disagreement on this. The recommendation is to note the decision made under emergency powers by the Chief Executive of Cambridgeshire County Council. Those in favour of that, please show. Those against, please show. Are there any abstentions? So that was agreed unanimously. Thank you. Item 13, infection control funding. This is on pages 165 to 170 of the agenda, and Shauna is going to present this to us again.
Thank you, Chair. So this report covers the allocation of discretionary elements of the infection control and rapid testing grants issued by central government in response to COVID-19. Throughout this year and last year, central government have released several rounds of funding to support the sector with the ongoing costs of implementing infection control measures and rapid testing. Responsibility for distributing the grants has been given to local authorities to passport through to the market. And the latest round of funding, as outlined within paragraph 2.1, was released at the end of March as the local authority was entering into purdah in preparation for the elections. The funding came with very clear conditions from central government. It's broken down into mandatory and discretionary requirements, and there was a condition stipulated in the grant that local authorities passported this funding through to providers by the 30th of June. For this reason, as the council had already entered into purdah, we had no option but to take a emergency decision in line with the constitutional process in order to comply with these timescales. In development of the recommendations, officers sought the views of a wide range of internal and external stakeholders, including local providers and care associations. And the approach has been outlined in the report. Just over £600,000 of infection control funding has been allocated across CQC registered community providers, open day services and housing related support services commissioned by the council, and £524,000 of rapid testing has been allocated to extra care providers and supported living providers in line with the conditions set by the grant itself, as well as voluntary sector organisations where they are engaged in the use of rapid testing to deliver their services. Thank you very much.
Thank you. Any questions or comments on this? Councillor Bowden.
Thank you, Councillor Howard. First of all, may I say that I fully support the monies which have been received and which are being utilised and for the purposes they're being utilised. I did start my speech during the last agenda item saying exactly the same thing, and I was a little bit concerned then for it to be suggested that, or to be implied that I wasn't concerned about the service provider issues involved. I give full support to this, as I did to the previous item. And as with the previous item, I have to say that this is an example unlike what you said, Councillor Howard, of money having been received during the previous administration, because this money was received in April, and the decision notice actually took place before the election took place in May. And I have to say, from a governance point of view, it took place perfectly well. But I think that it is really important, and I'm going to emphasise, because you didn't give me the opportunity to come back on the previous agenda item, it is really important that, as happened with this item, that governance procedures are followed properly. And brushing under the carpet occasions when governance goes wrong is a very dangerous thing for any organisation to do. Thank you, Chairman.
Any other questions or comments? Okay, I'll read the recommendation out, which is to note the decision made under the emergency powers by the Chief Executive of Cambridgeshire County Council to allocate the discretionary elements of the infection control and rapid testing funds provided by central government. Is that agreed? Again, I'm seeing nods all around the room. That is agreed by consensus. I'm watching the time, and I'm going to jump over 14 and come back to it and move to 15. Appointments to outside bodies and internal advisory groups and panels. Rhiannon is going to present the report, please. Could you get near the microphone again, please? Or move it upwards. So
yep.
Yeah, that's right.
Everyone can hear me? Yep. Okay. So we've got in the appendices the appointments to outside bodies and internal advisory groups and panels. Some of these we have received nominations for, and I believe the Chair and Vice Chair have discussed and decided upon them, and there are also some for which we will be looking for nominations, I think. And there will be further nominations to be made in the health overview paper. Thank you.
Thank you. As you know, the Democratic Services kindly sent an email asking members in advance where they had interests, and so I'm hoping it will be possible for us to integrate that in how we deal with this. Yes, of course. Councillor Bowden.
My apologies, Councillor Howard. It was just said that the Chair and Vice Chair had made decisions on various matters. May I just have confirmation from you that it is for this committee to make this decision? It's not for you and the Vice Chair, however well-intentioned both of you are, to make these decisions.
And I'm sure you're well-intentioned too. But of course, you recall the private conversation you and I had at 5 to 10 this morning, where I said we hadn't made decisions and it would be up for the committee. So it seems strange that you're now asking that question in a slip of a tongue by an officer again. I just don't think we should leap on those things. So I want to go back to the members that had contacted us. I might need Susan's help on this because we did look at this together. But to be very clear, and it's a proper question, anybody can volunteer for any point, but we'll make some recommendations of people who've taken the trouble to apply in advance, and I think that is a sign of their sort of seriousness in relation to that. So the first one we've got is Cambridge University Hospitals NHS Foundation Trust, and we had Councillor Bird who replied on that. Are there any other names for people who want to go forward on that? That's then agreed. The next one, do I need seconders, Rhiannon?
Yes, please.
Okay, can these be taken as read that it is proposed by the Chair and seconded by the Vice Chair, but to avoid us having to say that each time? We next then move to Cambridgeshire and Peterborough NHS Foundation Trust, and that was the one that I did discuss with the Conservative group leader. If there might be a Conservative nominee on that, it is our intention to try to get some balance between party representatives. But I'm not seeing any. Have I got from anywhere in the committee? Cambridgeshire and Peterborough NHS Foundation Trust, very important mental health issues. I'm giving you time to think deliberately. I am looking for a volunteer. Yes? That's a volunteer. Do you want to have a quick chat between you? Who wants it most? Please. It is Councillor Daunton who will do that then. Just checking there are no others. No, that's fine. Next, the Sustainability and Transformation Partnership Board, but it's going out of action and whether it will actually meet is unclear. So we could defer that. Could we defer that? We can defer that. Thank you. The next one is North West Anglia NHS Foundation Trust. Governors Tom Sanderson has approached us on that. Any other nominees, volunteers? That's Tom Sanderson. The next one is Royal Papworth Hospital. Was that? That was Councillor Slatter. Are there any other names? Councillor Slatter for that, please. Then we have the Internal Advisory Group. Adult Safeguarding Board is, I'm recommended by the officers to be the chair, and I'm just looking for a nod at that. So I'm putting myself forward for that. Are there any other names? No, that is myself. The next one is the Care Suites Member Reference Group. I hate the word Care Suites, by the way. In discussion with the Vice Chair, I think we're going to recommend deferring this. Is that correct? Yes, we're going to just get some more information about what it does and bring that back at the next committee, unless anyone objects. Okay. And the other ones are this afternoon. Have I missed any, Rhiannon?
Not that I know of, no. Thank you.
Okay. And do I have to read out those recommendations?
I think you can just say that you're approving.
We approve those nominees as external appointments. Is that agreed by the committee? Yep, I'm seeing nods. Any objections? No. Thank you very much, everybody, for that. Now, we've got two other items. The time now is 1:20. We reconvene at 2 in our health scrutiny function. I'm minded, but I'm asking you, that we do deal with the finance report, but we have a fairly brief presentation, and then the questions come in to give you a chance to answer them. And that in terms of the training plan, that we all read it and send comments in to myself and Susan, and we'll transfer them to or is there a single officer who would be most appropriate for that?
I'm very happy for comments to come to me.
Right, so I think better than to come to Charlotte.
Probably myself and Jyoti in terms of public health. Yeah.
Could it be one person?
Just me is fine. I should do it basically.
We don't want chaos in this committee. I'm minded to say that we'll just note that report and ask for people to approach Charlotte, but you may have a different view. Councillor Hay?
It's just, there's something that I must say about the forward agenda plan, because there's a glaring omission, there's something missing from there. Officers were asked at the last health committee to make sure that dental services came onto that because it had been deferred on more than one occasion because of the pandemic.
Yes, I've been told that as well, so I don't think there's any controversy about that. Yes, please. If you can come forward to a microphone, please.
Sorry, Councillor Hay, it's on the afternoon's forward agenda plan.
So we will come back to it this afternoon, Councillor. I do promise, because I've also been told that. So that gives us 10 minutes, if everyone is happy, to have the finance report. Could you just present it very briefly, and then I think it's better to get the questions and comments from members.
Yep. Thank you, Chair. Good afternoon, everybody. The
report in front of you is the Finance Monitoring Report for People and Communities and Public Health, a big integrated report for May 2021-22. The report, as I say, covers all those services, but it should be evident in the covering report and in the summary of the main report what the services are that this committee has responsibility for. I'll speak very briefly to the forecast, but the FMR does contain a lot more than that as well, and I would encourage you to read it. At the end of May, we're predicting or forecasting an underspend across this committee services of £518,000. About £220,000 of that is within adult services and £290,000 is within the public health services. The reasons are set out in some detail in the report, but broadly are due to activity on certain key demand-led budgets being lower than expected at this point in the year. And I'll leave it there, Chair.
That's very, very good. Well done. But time for questions and comments. These issues are important. Who would like to start off? Councillor Bowden, please.
Very quick comment, given the time. It has to be said that a finance report at this time of year really has very little information within it by definition because it covers such a short period. So the variances which are being projected for the end of the year probably will bear very little relationship to the variances which we eventually have. We do, unfortunately, have very few opportunities to question the finance arrangements now with the number of meetings that we've got. And I do defend my right to mention this because the fact that this decision has been made doesn't make it right, and showing some of the deficiencies of the decision which has been made about the number of meetings is a justifiable thing to be brought up. And the fact that we will have only effectively 3 opportunities to question the position so far as the budget is concerned and budget variance for the year is really not very good when it comes to potentially highlighting issues which we as members may have so far as the finances are concerned. But as I say, this isn't the right time to raise anything on the numbers which have been produced because they're produced just on 2 months' figures. What was much more interesting in the report, to be quite honest, was the additional funding coming in from central government, which was much more interesting than the variances which have been produced at this time. But I can assure you, and those members who've served with me before, both on adults and on health, will bear witness to this. When it comes to the more substantial information we'll get on budget variance analysis in 3 months and 6 months and 9 months' time, I can assure you I'll have many more questions to ask.
Any other questions or comments, please? Okay. I'll just assure the committee that we'll make sure it's timetabled sufficiently early in the agenda that we don't get to this problem, because, again, that was a very fair point that was made, although it's obviously 4 meetings, not 5, so whether that's substantially different, let's just agree to differ on that. Okay, I don't think that was a question to you, so Stephen, that's, by the way, Stephen Howarth, Strategic Finance Manager. I didn't formally welcome you, I apologise about that, but thank you very much, and we look forward to seeing you on those future occasions. So, I'm going to just double check I've not missed anything, Rhiannon. I think we've got there. Yes. So I'm going to adjourn the meeting. It's a lunch half hour rather than a lunch hour, but I think we've done some great work this morning and dealt with some really good issues. So I do thank everyone for that, and we'll see you in this room. Please put your masks back on as you get up at 2 o'clock.
Chairman, can we leave items in here?
think we're all here. I'd like to particularly welcome the district colleagues who are joining us, and you were formally co-opted this morning. Would you, just so we all get to know each other, I'm not going to go around everyone, it would take too long, but I think there are 4 district co-optees, so perhaps I could just go 1, 2, 3, 4, and just you kindly introduce yourselves.
Hello, so I'm Sarah Wilson, I'm from Huntingdonshire District Council.
Thank you.
Hello, I'm Corinne Garvey and I'm from South Cambs District.
Thank you. And just, not just to yourselves, but everyone, you speak, have the microphone pointed towards your mouth and try and speak into it, because the acoustics are a bit against us as we're all spread across. Yeah.
Hello, I'm Sarah Bajan and I'm from Cambridge City Council.
And I don't think we've got the 4th one yet, is that right?
Yes.
Where are we looking? Over there, great. There was a draft there this morning, so I hope you're not in a draft.
Yes, I'm by the drafty door. Liz Every from East Cambs District Council.
Liz, and we know each other a bit actually, so welcome. Oh, there's a 5th one. There's a 5th one. I obviously can't add up, so that's been revealed to you exclusively this afternoon. Please do, and I apologise.
Hi, good afternoon. I'm Samantha Clark, Fenland District Council.
Okay, thank you so much to each of you. You're very welcome. I have to apologise to the county members, but I just have to summarise, as it's a new part of the meeting, that we welcome the members of the public who are joining us on the live stream, and the members of the public and the press who are with us in the hall. We do support filming, recording and taking photographs as long as it's not disruptive. We're clearly in the Cambridge Corn Exchange to comply with the public health guidance on COVID safety. We can all not have our masks on for the duration of the meeting, but when we get up and leave our seats, can we replace our masks, please? And members of the public, please keep your masks on throughout. If you wish to speak, for all the members, simply indicate your hand, and Susan Van der Ven, the Vice Chair on my left, and myself will be watching carefully. Hope we don't miss you. Seemed to work okay this morning. Please ensure that your mobile phone is turned off or on vibrate only. The toilets, the ladies' toilet, you go through that middle door there. There's a one-way system to and from all the toilets to, again, maintain social distancing, so it involves climbing some stairs in both cases. So the ladies there, but please follow the one-way system. The gentlemen's toilet, back through the entrance you came in and on the right-hand side, follow the arrows. And the accessible toilet for people with disabilities, straight back to the very front door, right-hand side, just beforehand. There are no fire alarms expected today. We can all see the green arrow signs there, and there. We should use those if there were to be a fire. And we should assemble at the front of the Corn Exchange if that is the case. So, welcome. I don't know, I even said my own name, Richard Howitt, and I'm the Chair of the Adults and Health Committee for the new County Council. I've already introduced Susan, our Vice Chair, and I'd like to welcome everyone to the Health Scrutiny section of our Adults and Health Committee meeting. We have, for the district members who have kindly joined us, we have undertaken a committee restructure within the authority, but the health scrutiny element will remain much as you remember it if you've been helping us with that in the previous term, but we'll be having the health scrutiny as a meeting in the afternoons when the other business of the Adults and Health Committee is undertaken in the morning. So this Thursday, they're all Thursdays, so a Thursday afternoon is the time to watch out for, and we do have all of the dates going ahead, so hopefully you and your authorities have already given you those dates, and Jyoti is there. Yes, you are there. My eyesight is not absolutely brilliant, even with glasses. Just again, for the district members, I'm delighted to introduce to you Jyoti Atia, who is our new Director of Public Health. If you've been with us before, in the previous term. You'll probably know the other officers, Kate Parker being our principal officer in relation to this work, but I'll make sure I introduce all of the officers when they speak for the first time. But I think it is going to be Kate next, because we move to item 17, overview of health scrutiny. And the aim of this section of the report is to bring all members up to date with what our health scrutiny function is, how we've operated that in the past, and also some of the things that are pending. And Councillor Hayard has got an issue that she wants to raise over that, and I'm sure others too. So, Kate, please address the meeting.
Thank you, Chair. Thank you. So the paper that is in front of you now, hopefully, is the overview of the health scrutiny function that we conducted last year, so during 2020-21. As you can imagine, it was significantly impacted by the COVID pandemic. So we didn't effectively scrutinise the NHS during the beginning period of 2020 because we needed, obviously, the NHS to get on with their response to COVID. But I am really pleased to say when I wrote the report, actually towards the end of the last financial year, we really did bring scrutiny back into the Health Committee, and we were delighted that we were able to reconvene our liaison meetings with our trusts. So we conduct scrutiny in a number of ways, formally through the Health Committee and now the Adults and Health Committee, and then informally through your liaison meetings with your local trusts and your meeting with senior members of those trusts. So this report summarises some of the activity of 2021. So we did focus pretty much towards the end of the year on the recovery aspect, inviting in the Sustainable Transformation representatives to talk about their recovery planning. We also looked at inviting in CPFT as well, which is your mental health trust locally. And again, they were talking about their response to COVID-19. We have a function as well around performance and quality. So quality accounts are something that you will receive as a committee going forward from the NHS. And those actually are a statutory responsibility for the NHS to share with you. So going forward next year, you'll start receiving quality accounts from all the trusts. We also received a clinical commissioning group finance update, and that's also important for you to know as a committee. The CCG has to share their finances with you and their plans with you. We took on some thematic scrutiny areas, and some of those that were mentioned in the earlier this morning session was the NHS dental services in Cambridgeshire, and we will be inviting back the NHS England, the Commissioners of Dental Services, hopefully to your September meeting. With your permission, obviously the last element of today's agenda will be looking at your scrutiny work programme, so if you all agree, that would be the plan to bring them back into the September meeting. We also looked at service developments, and there are significant service developments going on within the NHS. We had reports from the Cambridge Children's Hospital project. We had reports from Addenbrooke's regarding their Addenbrooke's 3 update report, which is their biomedical campus redevelopment. And we also heard from the Cambridge Cancer Research Hospital. So the NHS have received significant funding to start setting up a cancer research hospital in Cambridgeshire. So the report really is just an overview of what happened last year and an ability to try and bring all the new members up to speed with the activity that was undertaken. And then it formally asks you to consider representation on some of the liaison groups that I mentioned to you earlier. So I'm quite happy to take any questions on kind of the liaison groups before members perhaps put themselves forward for participating in those. But I do understand that our chair and vice chair have probably received nominations already for potentially some of these groups.
But there's 4 in each, so there's going to be plenty of opportunity. But what I suggest we do is leave the appointments and have a general discussion, any comments or questions about our role on health scrutiny, for people who've been here before to comment on how you feel it's gone and how it could be improved, to ask any questions of Kate. So can I invite any members to speak, please? Susan.
Thank you, Chair. not to take it back to those liaison group appointments, but rather to say that our ability to scrutinize, to genuinely understand and probe and discuss with our health partners, I think has been extremely enhanced by the ability to have these informal quarterly liaison meetings. That's a chance for real focus that can't by nature happen in a formal meeting. And I would just encourage people to sign up for them. Councillor Hay and I have been involved in a number of them. So it's a really valuable resource. Thanks.
Thank you. As I say, I'm keen to have an opportunity for people to comment and ask questions generally on our work on health scrutiny before, and then I'll take us to the actual appointments. Yes, Councillor Wilson first.
Thank you. Apologies if this is a bit of a naive question, but previously we talked about provider collaboratives, and I just wondered if you could clarify how the regular reporting of the CCG finances is likely to evolve, if we have any idea, and confirm that it won't just be finances, but it will be delivery of value for money rather than just delivery of money.
Very fair question. And Councillor Slatter, I think, wanted to speak.
Yes, in this business of trying to catch up with the health scrutiny and what you've already scrutinised, you mentioned the Children's Hospital and the Cancer Research Hospital. Are there past papers that we can look at? Are there plans we can look at so that we can catch up on just what is being suggested?
Yes, absolutely. They're all on the website on the Health Committee, but I'm quite happy to circulate out the papers that were brought to the last Health Committee on both of those. They're really, really in-depth papers. They will provide you with a very good oversight of the proposals. So, yeah, happy to forward those on to the committee.
Thank you. Spoon feeding with links to bits of the website, always welcome for newbies. Thank you.
Good for all of us. Good advice. Thank you. Councillor Daunton.
Thank you. On page 242, you mentioned under new developments the integrated care system and suggest a development session. Is it for this committee to decide on that? I think that would be very helpful. And maybe we could discuss the contents of such a development session.
Yeah.
Just see if there are any more first, Kate. If new members, don't be shy. I'll ask you one as well. As I understand it, this is a really serious function where we advise the Secretary of State at the Department of Health, and that what we say really matters. So could you talk about the sort of statutory basis of our responsibilities in this effect and the sorts of things that we should be mindful of, I suppose, in undertaking this function, bearing in mind it does go to the Secretary of State? Kate.
Thank you. So I'll take the first question on the ICS. So absolutely, the last paper that you're going to get today is your draft work programme, and actually scrutiny, as I've said at the training session to you, is member-led. So you will obviously advise me what you would like to see on your scrutiny work programme. And one of my recommendations would be that we have a development session for you on the ICS, and then that will enable you to have a proper formal scrutiny session perhaps towards the end of the year, but having that background understanding of what the ICS is planning to do, and just giving you that kind of focus. So that was one of my recommendations, and hopefully we can look at that at the end of today's session. So moving on to the other question regarding the statutory responsibility. Yes, you have, as a health committee, upper tier authorities have the statutory responsibility for scrutiny. And that is scrutiny of the NHS and providers of NHS services as well. So there is an aspect there that you can scrutinise other providers that are providing NHS services. There is a requirement on the NHS to consult with you on service developments and service changes, hence why I've suggested the ICS, because that is a big change in the NHS going forward. What you do have the right to do is, as a scrutiny committee, refer any decisions up to the Secretary of State. We haven't done that as a committee before, but other committees, scrutiny committees have, particularly around service changes. So that is one to kind of look at in future. You also have the right at the end of your scrutiny session, when you've invited in NHS representatives, to put forward recommendations to those NHS organisations, and they have an obligation to respond to what you have said. So if you have got concerns and you've written and put recommendations forward, they then have to write and reply to you as to how they are considering those recommendations.
Thank you. And then to introduce the point where we're going to make the appointments, could, rather than do them one by one, just talk a bit about what these advisory liaison groups are, what function they have, and then we can take it through one by one. But if you could talk about that overall.
Yes, thank you. So the liaison groups, I have to say, they're actually unique to Cambridgeshire. I do participate in a national scrutiny officers group, and nobody else has really managed to do this. And the key to this is relationship management and relationship building. And as you've heard from Councillor van der Ven, they've really proved helpful in really developing a very good scrutiny approach. So what they are is basically your provider trust, so your Addenbrooke's Hospital, your MWAFT, which is your Peterborough City Hospital, Hinchinbrook Hospital and Stamford Hospital, those trusts, as well as Royal Papworth, so all of your acute trusts, they're allowing us to kind of meet with them in an informal capacity with representatives from the committee to talk about the upcoming issues that particular trust may be experiencing. In particular, in the past, we've taken on when they've had a CQC, which is when they've had an inspection. So your CQC is your inspection for a hospital, similar to what Ofsted do for schools. If they've had a CQC inspection report that has come up as inadequate or requires improvement, that has also been discussed at the liaison meetings, and it's a good opportunity to get to the real core of the issues and then focus your scrutiny session on what those issues are, whether it be leadership, whether it be financial, whether it be service changes. So they've been really good. We've also included the CCG in that as well. So we'd have a joint liaison meeting with Health Watch, and my colleague here is from Health Watch, who will be introduced shortly. And they have really proven as an ability to informally find out what is really going on in that trust, what issues you feel need to come back to be formally scrutinised.
And could you just clarify, we've made a number of appointments of county members to like the boards of some of these. Should that member also be in the advisory group or not?
So we haven't, because these are informal advisory groups, we haven't ever restricted somebody from doing that. We did have an appointment in the last committee where there was somebody on, I think it was Royal Papworth Hospital Trust, who also came to the liaison meetings. Because they're informal, I would say they're not minuted, but what I do bring back to committee is a report on the topics that were discussed. So, and the reason we don't minute them is that allows us to have a really honest conversation with the chief execs and senior members of those trusts. And then it just gives you a feel as to what topics were coming up. So it doesn't exclude you from being a member of the liaison meeting if you've actually opted up to be a governor or a representative on the trust boards. That responsibility is slightly different. So if you've been put forward as a local authority representative to sit on the trust board, you are representing the local authority. So slightly different. You're not there as a scrutiny member and a member of this committee in the scrutiny sense of the word. You're there as an appointment from the local authority.
Okay, so we'll just take that on a case-by-case basis, but everyone's heard that answer. So I'll just go straight to the appointments now. Yes, I'm being smiled at, so that must be the right thing to do. Susan and I have looked at this in terms of what we as either chair or vice chair might want to put ourselves forward to, so I'll indicate where that's the case. And we also have one member who's already told us, who's not able to be here sadly, but who's told us that he would like to do that. But it's for anyone can put their names forward, and I stress district members and county members together. There's no distinction between us in undertaking this function. So I think we've got 5 to do. The first one is Cambridge University Hospital NHS Foundation Trust, Adam Brooks. We've put Jerry on the board there, so you have to decide whether you'd also like to come to these meetings. And both myself and Susan would like to put ourselves forward for the advisory group. Can I look at other names of people who'd like to put themselves forward? We're looking for Jerry. Great, yes.
May I ask, is this are we talking about one person? If I don't have to be in competition with Jerry, it would help if I knew whether
No,
she
we've definitely got at least one vacancy without competition.
Right. And is this the sort of thing that can have a substitute going in, just to make sure?
Kate, just help us on that. What happens on substitutes?
So we normally haven't put substitutions in. We just take your apologies if you can't attend.
Okay. Right. Yeah. I think I'm going to just have to come out with this one then. It could be, it's not exactly a pecuniary code of conduct, but I am the division county councillor for Trumpington, and we know that there are implications of some of the aspirations of the trust in terms of how it in terms of the space they will take up, that sort of thing. So I'm sure anybody in this room sympathises. On the other hand, as a professional background, I would really like to be helpful and pick up on the clinical and health side of it. It just may be that sometimes I shouldn't be in the room and it may be awkward. So I would love to be on part of it, but I'd sort of be glad for your advice, Mr. Chairman, on that.
Well, you're being very open and transparent, which I'm extremely grateful for. I see no problem about that personally. But let's just see. Have we got other names? Otherwise, we've got off. Jerry, do you want to also be able to attend these meetings? Yeah. So we've got our 4, but I don't want to close it down. Any other names want to come forward? Is it agreed then? It's myself, Susan, Jerry, and Councillor... Sorry, I'm mixing between first names and second names. I do apologise. Councillor Baird and Councillor Slatter. Is that okay with everyone? So district members, we do nodding in this committee. So I like nods. And then if I don't get them, if I get shakes or harumphs, I take a vote. That was agreed. The next one is the Cambridgeshire and Peterborough NHS Foundation Trust. We're looking for 4 people. Susan is one that I'm going to put forward, but 3 spaces. Who else would like to take part in this, please? I'm looking. Thank you. Councillor Taunton.
Chairman, yes, I would be prepared to do that, but I noticed that we already have dates of meetings, and I know that I can't do the meeting on the 21st of July. I don't know whether that rules me out.
I'm just hearing from my left that those can be flexible. I think from the committee's point of view, we want people who are genuinely interested, who will want to come. If there's one meeting you can't come to, so be it. But it may well be that we can be flexible about that date anyway. So if you're genuinely interested, I encourage you to put your name forward. Yeah.
Okay.
Any other names? Just looking to my left to the Conservatives. Any names? Be good to get a mix of parties. No? So we've only got 2 at the moment. Any other names from anyone? Well, let's agree those 2 then, and just record that we've got vacancies, and we'll just have a think about maybe writing around afterwards. There's 1 or 2 members missing. There's 1 district member who's substituting, so we might write around afterwards if we do have vacancies. Let's get as many as we can, and I encourage people to volunteer. This is an important part of our role, and enables us to do our committee work. The next one is Cambridgeshire Community Services. I've got two suggestions here. One is, again, is Susan. A second one is that they deal with children and young people's health services too. So I was thinking we could reserve at least one place and ask the Children and Young People's Committee to nominate. Is that a sensible? Do I break any rules if I suggest that?
No, Chair. Committee members.
I would say at least one other person from this committee would be good. Got any names of people interested? Oh, great, thank you.
I'm not giving you my name. I would be interested, but I'm an employee of CCS, so I presume that would preclude me.
Yeah, it does. I think that must do.
Yes, that's unfortunate, isn't it?
Yeah, it's a conflict of interest. See, Kate again.
I just wanted to add that we haven't actually formally had a liaison meeting with Cambridge Community Services, and it was at the request of the committee, the Old Health Committee, that we start setting them up. So because they are providers of a range of services in Cambridgeshire that everybody was feeling was worth scrutinising. So I would just say this would be a new relationship, so it would be good to have a couple more councillors on that one.
Can I encourage one more person to come forward?
I was employed by them for 40 years, so I don't know whether that qualifies me or not.
Do they pay your pension?
I think it's fine. I think a current employee is a problem, and thank you again for being so open and honest, but I think a past employee I think is not a problem at all. So if you're willing to do it, I would encourage you to put your name forward.
Okay, yes, thank you.
I don't know the district members' names, so I haven't learnt them all round. I'm really sorry. I might just say, Councillor, look at you. I really apologise about that. I'll learn them. We next have the CCG and Health Watch. I don't really think we scrutinise Health Watch. I think they help us scrutinise in truth. But that's what it says on the bit of paper in front of me. And the CCG are going out of business, of course. So I don't know how important this one is.
Dan?
Yeah, go and speak.
I'm just thinking the regular informal conversation with Health Watch is important, and it might fulfill that function as opposed to formally coming to the scrutiny committee.
Yeah.
So I'd suggest we keep it going for now.
Okay, if it's Health Watch, I'd like to put my name forward. And you're happy, aren't you? So that's two. Any others? Okay, we've got two to start with, and we'll note two vacancies. The next one is the Royal Papworth Hospital Trust. And Susan, again, you were interested in this, so others for the Royal Papworth? This is the quietest it's been all day. Do I see? Oh, brilliant. No, I thought there was going to be a hand, but there wasn't. Please.
I just wonder, during the pandemic, these meetings have taken place virtually, and I think it suits the health partners that we continue doing that, and I think that might make an enormous difference to us because these are long distances to travel otherwise, and everyone's busy. So my assumption was that it would suit the other side of the table if we continued to do it that way. So I don't know if that makes a difference or not to people.
And might suit people on this side of the table. So do I have anyone else for Royal Papworth? I don't. We just have to have one person and 3 vacancies. We'll obviously have to review this. And then North West Anglia NHS Foundation Trust. So we did appoint Tom Sanderson to be on the board, but also to attend the advisory group meetings, and we can have up to 5 people for this. Hinchinbrook Hospital.
Mr. Chairman, I was thinking about something else. I do apologise. Could you say that again? It's Hinchinbrook.
Yeah, it's called the North West Anglia NHS Foundation Trust because it also runs the hospital in Peterborough, is my memory, and I think something else. But it covers Hinchinbrook Hospital in Cambridgeshire.
Yeah,
we prevail upon you?
Unless it was somebody on somebody else's
There's
patch.
5 places.
I just feel I should know a bit more than just Adam Brooks, which is up my road.
Okay. Councillor Slatter.
But on the other hand, it's virtual, so I may not find much more.
We've got a name, which is very good. Anyone else? Okay, we've got at least 2 names there. You didn't want to do that as well? Yeah, Susan's. We've got 3 names there. Thank you, Susan. And then the last one is the Cambridge Cancer Research Hospital. And did we have anyone for that? Yes, you were going to do that again. Sorry, Kate.
So the Cambridge Cancer Research Hospital is an engagement role, so it's slightly different. It's just one counsellor or 2 counsellors, sorry, that they're looking for. But this is because they will not be bringing you formal consultation, because that was agreed at the last Health Committee scrutiny session. So what they're looking for is members to sit on the engagement board so that you're fully briefed on the development as the hospital moves through its next couple of phases. So it's a really important one to be on if you're interested in that particular that particular hospital.
We've got 2 places. Susan, one of them. Is there one other person?
So the hospital is going ahead?
They're at the moment looking at funding, so that's what you'll see from the papers that I'm going to forward you, is that they've got substantive funding from government, but they're also looking at funding from public funding, research funding as well. So at the moment, it is the development phase. So it's keeping an eye on how they're progressing with it and whether or not they can actually move it forward.
But do we know if they've actually got planning application in?
Not yet.
I think that will really be a problem for me. So, in terms of as a division rep.
I don't, but I do respect that you choose for yourself what you think is appropriate.
I'd like to know what's going on my doorstep, but I think I might be in an awkward position to be doing a health type function.
Okay, let's just respect that, as you say. Councillor Dupre.
Chair, I haven't volunteered for anything else yet, so I don't mind volunteering for that one if it's helpful. I think it's an important development to keep an eye on.
Brilliant, thank you so much. So we've got our 2 on that, so thank you. I think I've done it all. The recommendation of the report overall, as well as making the appointments, was to note the scrutiny activities during 2020-21. Are people happy that we've done that? Oh, sorry, another point, please.
Yes, Chairman, if I could just be clear. The members who volunteered to take part in these liaison groups, we will be contacted. It's not up to us to contact the Kate or her officers. I'm just wondering, not to miss anything.
Yeah,
and the other things that we volunteered for in the session this morning, officers will, when the minutes have been written, contact us and give us numbers to ring or to email.
Don't worry, they will. One of the things I've learned since becoming a county councillor is there's no shortage of emails from officers inviting you to do things on particular days and times. They're very, very good at it. So there you go. So the recommendation is approved. People nodded. Next, I'm really delighted to introduce you to the Chief Executive Officer of Healthwatch Cambridgeshire. We're dealing now with item 18, the work of Healthwatch Cambridgeshire. It's on page 251 to 254 of the agenda. I'm a big fan of Healthwatch. I think they do a brilliant job. I don't know if this is the scrutiny function or not, but I'm going to say it anyway. But also, I see them as a key partner for this committee to do our scrutiny function because, as you're going to tell us in much more detail, you're the eyes and ears and information gathering about how the health service is doing in our county. And so I'm particularly pleased to invite Sandy to talk to us this afternoon.
Great, thank you very much, Chair. So my name's Sandy Smith. I'm the Chief Executive of the CIC's name is Healthwatch Cambridgeshire and Peterborough, but we deliver the Healthwatch Cambridgeshire function as a distinct function, so I'll stick to that today. I've given you a paper which has been circulated, and I believe you've got some slides as well. In the paper, there's a brief background of our Healthwatch, how we work, how we came about. And I'll just, moving on from the conversation that you just had about scrutiny powers. So we have, Healthwatch has the power to refer to scrutiny. And I would like to think that the liaison meetings that we have with the CCG are kind of like a way of sharing intelligence rather than you scrutinising us, although there are other routes by which the local authorities can do that. So I'll come to more of that at the end. So the topics that we have referred, or we would have referred in the past, I'll come to at the end of my presentation if I can. Also in the paper that you've got is a brief description about how we collect our feedback and how we develop our evidence base and the ways that, particularly in the last incredible year, how we've managed to, quite miraculously in a way, still keep in touch with our communities. It's been a challenge, as I'm sure you all appreciate, but we, the fabulous team at Healthwatch, we are so lucky to have people that are really flexible, adaptable, motivated and supported by a band of great volunteers. We've been able to move all of our engagement online and carry on some vital work through online, telephone, email and by virtual means. So I've presented some of that in the paper, and you've got more detail in the slides that I've circulated. So I've started off in the slide pack by highlighting some of the key themes that have emerged through the past year. A year like no other, as we all appreciate, and it's been difficult for the people that we've heard from. It's been difficult for the staff. I think it's been difficult for everybody, but all the work that we've done, we've heard amazing thanks. I mean, that is the primary message that we hear from our communities, is the gratitude to NHS and social care staff for the work that they've done in keeping them safe in the past year. It's and now the vaccination programme rolling out so brilliantly, we think, here in Cambridgeshire. So it's fabulous thanks from all of our communities to those staff. But as you'll not be surprised, there's difficulties too arising just from delayed demand, additional stress that's been placed on everybody. And on the second slide, I've listed down some of those pressure areas that we're hearing about. So I won't read through them as you've got this, but number one on our list has been dentistry. As Kate's already mentioned, I'll come back to that at the end. We are hearing from people about how difficult it is to get various appointments and GP appointments, and it's probably the inconsistency, and people are having to wait longer, but you know there is a certain amount of acceptance by the general population, but it's really important that in that everything is got right so that those in most need are seen first. And that's what people tell us, is that they're quite happy to wait as long as those are in most need get seen first, and that everybody, this is such a big thing at Healthwatch, everybody has good information. So that's what all of this is underpinned by, is people having good information. And aligned to that is the impact of people that are digitally excluded. And the slides, the next 3 slides that I've sent you tell you about the survey that we did with people in Cambridgeshire during the between the two waves actually. So over the summer we asked people what was important to them, what their experiences were, and I've listed down the themes of what people told us, and it's nothing that that I haven't already, what I've already mentioned, but also the theme about people that just cannot do things online. So that and the disproportionate impact on marginalised communities. So I think it's been clearly accepted that the health inequalities, where you were on the health inequality scale at the beginning of pandemic determines where you are now. So we've heard from people that those that were most disadvantaged at the beginning of the pandemic are even experiencing more disadvantage now, and that's very true about people that can't get online and people that are rurally isolated and don't have support from families. So I'm not going to read through the themes because you've got the slides and you can read through that, and I will just flag the mental health aspects that we're all aware of, that how people have coped throughout the pandemic. Some people have actually said it's done their mental health quite good. There has been a small positive impact for some people, but some people have really struggled, not least those people with disabilities and children with disabilities. So I've also included a quote, and also some links are in my slide pack, so please do have a look at the main report itself. Some of the quotes are quite hard to read, but it does give you insight into the lived experience of people that have had a very difficult time. So services did stop for people, and there's been confusion about that. There's been confusion about what services stopped and what services carried on. There was confusion about shielding, who should shield and how they should shield. And we've been pleased at Healthwatch, our information service has helped clarify points for people, and we've had a brilliant response from our trust and our CCG. I have to say I'd like to give them thanks as well, is that we've taken issues to them, and I can give you an example about people that were housebound. Some people that were housebound were getting missed off of the vaccination programme. We got in touch with the CCG, and between them and CPFT, they sorted it out. So every time we found one person, I know it's one person, but that one person's having a really bad time, you know, they've been great in sorting that out. But it does worry me about the people that don't know to come to talk to us. So I'm sure out there are people that are not getting that help and that information that they need, which is a bit of a worry. So another piece of work that we did during the pandemic was, well, we are through it, but earlier in the pandemic, was look at our GP websites, conscious of how important online information and website access is for everybody. And again, you've got the link in your slide pack. And again, with general practice, as I said before, it's a really inconsistent picture. So that's what people tell us about what it's like to get. It's probably the same experience that you have yourselves. Some people have great access to their GP surgery, other people really struggle. So we are keeping our intelligence fed into the CCG and to GPs themselves to try and highlight areas for improvement. And websites is something that was desperately needed to be improved, and we're really pleased that we have seen quite a improvement there, and we're going back to do a review in the autumn. Another area that we looked at with, in partnership with our local authority colleagues, and I'd like to thank County Council colleagues for helping us do this, was that we interviewed a number of people that had recently left hospital during the COVID period and found out what their experiences were of leaving hospital. Again, you've got the link there so you can read the report if you'd like to. It's quite short and to the point. But what was really interesting for us was that Healthwatch England carried out a similar piece of work nationally, and our findings locally were almost the same as the Healthwatch England findings. And so that triangulated our findings for us. So it was a qualitative study. It was a small number. There were in-depth interviews with about 35 people, but it was correlated by quite a large statistical exercise that Health Watch England and other Health Watch carried out. And the key things that people said was most of them did feel ready to go home and they wanted to go home. Everybody wants to leave hospital, absolutely no doubt about that. But they did say that they could do with better information, and I'm pleased that County Council colleagues have actually designed an information leaflet already, which we're helping to get out to the trusts. And also there were key points about transport and community equipment. So those issues are being followed up through the local transformation programme around discharge from hospital. So I think that's quite a good example. So again, I will say again that where we publish a report and we circulate our findings, it's always welcomed. I think the relationship, I'm so pleased to have such a positive relationship with our trusts and our CCG and our social care providers. So we're really pleased about that. I will just say something about social care. Another function that Health Watch has is enter and view, where we can enter and view health and social care premises from a patient experience perspective, not quality and safety as per the CQC inspections. Because it has been a pandemic, we've put our programme on pause, and we're looking to start that again in the autumn, and we'll be using national guidance to make sure that we do that safely. And also we want to give our care homes have had a tough time, and we want to give them a chance to recover before we add any additional burden to their scrutiny. But we do receive feedback about social care. There's absolutely no shortage of that, particularly through our partnership boards that we're commissioned to deliver on behalf of the County Council. So, nearly at the end of my presentation. So, the last slide that I've sent to you is what I was asked to provide you with was areas for scrutiny. So from all of the work that we've done, from the general feedback that we get, from the reports that we've had, I've given you a list there, and I will actually go through these one by one and give you a bit of background. So firstly, the fragmentation of services is something that we see in people's experiences, particularly when you're leaving hospital, because that is when all of the services come together. So it's not surprising that there's people that fall down between those doors, particularly during such a difficult time that we've had last year. So the fragmentation of services and the way in which there's duplication in some areas and gaps in the other areas is something that concerns us, particularly when it's around information and the public understanding who does what and who you go to for what. Those of us that work in the system find enough trouble navigating the system. So goodness knows what it's like if you're dealing with additional struggles as well to find your way around that system. So that and so So the optimism here is the integrated care system, and we're quite excited about that at Health Watch, and we're really pleased to be involved. We've been involved in the development of those plans right from the beginning and advising on patient and public engagement. So the second point, NHS dentistry has got a bit of a history. So if we published a report a few years ago now, and it was actually in the north of our area, and particularly in Fenland, the difficulties that people were having around with speech, getting urgent and routine dental care. So we did speak to overview and scrutiny at the time. And actually, it was already on the agenda. So if it hadn't have already been on the agenda, we would have made a formal referral there. So we're really pleased to be keeping scrutiny abreast of what's happening. We had a paper to our last board meeting, which actually summarises quite well the I hope very well, the experiences of people, the plans for NHS England, and I'm really pleased to hear that you've got a report coming back on that in September, and I'm quite happy to to provide you with some update on that from our perspective. So the next point about increasing demand is it's absolutely evident that demand is increasing, because I think a lot of people have been just putting up with what they've got and now they need some help. It is inconsistent to get a GP appointment. I've mentioned that previously. And the last point I'd make is about mental health, and particularly for young people. And we have a report that we're publishing shortly, which we've done as a pilot for NHS England, developing a methodology of developing health and care experience profiles, get the terminology right. So we will be publishing that soon, and so I think there's quite a lot to be done on that, and I am worried about unmet need, especially around eating disorders. So I'm going to pause there for questions. If I could just do a little bit of a commercial for signing up to our news bulletin, and you've got the link on your slide set. Our AGM, which will focus on inequalities, and that is next month. It's all online, and it's a dip in, dip out, so you could come just along for just one session if you'd like. And lastly, please do refer people to our information service. So if you're speaking to people and you have experiences, please either tell us or get in touch with our information service, and we're only too pleased to help. So I shall pause there for breath. Thank you.
That was very full, and also the slides were great to have those in advance, so thank you very, very much indeed. Let's take a round of questions and comments, starting with Councillor Taunton.
Thank you, Chairman. I'm interested in what you say about GP services and the unevenness of them. And really it's a question to the committee. I mean, thank you very much for all the work that you've done on that. What are our other mechanisms for contact with GP services and for scrutinising GP services?
What we're doing at the moment, Sandy, is if you take a note of questions, and then I'll bring you back after a group of questions, if that's okay with you. Who'd like to go next? Yes, please.
Thank you, Chairman. Through you, Sandy, your passion shone through. That was wonderful. Thank you very much, and a really good report and everything with it. Just one point, and it's a very minor point, but I'm new to the health side of this new committee, and I really welcome what I think it is that you and your world do. But before you joined us, we were told this morning that we're behind on our vaccinations in Cambridgeshire. And you've come in and said what a marvellous job we're doing, and you're checking it. And it just made me think, hang on a second, how out of date are we? What's the information lag that you are looking at compared with what our colleagues shared with us earlier? So if you can have a thought on that, please.
Please. Yes, Councillor Hay, please.
Thank you. You mentioned the dental services and how difficult, particularly in the Wisbech area, is to get treatment. Part of the problem, I believe, is because more and more dentists are forsaking the NHS to go private. In Chatteris, where I represent, we at one time had 2 dental services, both of which took National Health Service patients. Now, neither of them do. What can we do to encourage more NHS dentistry to cover areas such as Chatteris? As it is, anyone in Chatteris who can't afford to go private has to either travel to Ely or Ramsey.
Thank you. Councillor Wilson.
Thank you. You mentioned, and the slides say that 1 in 3 people said they waited more than 24 hours to be discharged from hospital. The main reason for the delay was transport. Is there anything which the County Council should be doing to address that issue?
Councillor Dupre, please.
Thank you. I was going to ask you about what you regarded as being some of your successes, but I think you covered that in the presentation, though, you know, if you'd like to amplify, I'm sure that would be good. Instead, I was wondering what you regard as being the most intractable problems that we face in the healthcare system that you come across, and how we could work with you to help overcome them.
Okay, we're nearly there. But Councillor Corney was next.
Yeah, thank you, Mr. Chairman. Sandy, thank you again. The slides especially, they were very helpful. As you went through them, I think it was a great aid. The survey is very interesting. I think it'd also be really interesting to know, have you got any plans to sort of redo the survey? It'd be interesting to compare results from last year to how people feel now. And secondly, if I may, Mr. Chairman, when we look back, and I'll use slide 5 as an example, I think it says it sort of highlights a good practice of what's come out of the COVID sort of pandemic. Equally, I guess we're probably all aware of the way the service is misused, and I think there's an element that maybe people have changed the way they use a service as well. So it could be for the for the good, as well as sometimes it's a very fine line between people being missed and and actually not misusing the system. But I guess out of what you see, what we've got in front of us, is there anything you can be taking forward to encourage further use, such as the telephone triage and so on? Thank you.
Thank you very much, Councillor Van de Ven.
Thank you. I wanted to ask if you could comment on the problem of the postcode, not a lottery, but in our border areas in our county, we have some instances of GP practices that are registered under a different CCG and under a different footprint. And equally, we take in some out-of-county geography into our own footprint, and that can be a very distressing area for people who are having to navigate the services they need, which would be hard anyway. I wondered if you could comment about that and whether you see any improvements on the horizon. I don't suppose the provider collectives, and that's the first time I've said those two words, will have any bearing on that particular problem. So just wanted to put that to you, and thank you for helping sort out that casework in that arena in the past. Thanks.
Finally, me. Provider collaborative, not collective. Perhaps we've invented a new term this afternoon, you never know, just to make people even more confused. So provider collaboratives, we learn, is getting rid of the purchaser-provider split in the NHS. Do you welcome that, and what's your response to that? And if we get involved with it, is that a good or a bad thing? Secondly, we, like you, are very keen on the integrated care service, and we want to make it work, and we're making it a real priority for the county going forward in the new term. But I wonder if you could say why you're so keen and enthusiastic, because we're all learning, and it would be interesting to hear what really about it you're very hopeful and enthusiastic about. Thirdly, do you do any comparisons with Healthwatch colleagues elsewhere in different geographies? And have you got anything that you could say to us about where Cambridgeshire is lagging? You exist and we all exist because the health service has problems and challenges, and it always will do, and we're part of the feedback system, and that's a good thing. But is there anywhere that really Cambridgeshire is lagging in terms of health services? And I did have a final one, sorry. Yes, really the same one, but to enhance what Councillor Wilson said about hospital discharges. So, we're not just scrutinising on that, we're also trying to provide a service. And feel free to be candid. Tell us if we're not doing it well or we could do it better, and how. And we want that feedback. We wouldn't see that as criticism. We'd see it as helpful and constructive feedback. Sandy.
Okay, great, thank you. Wow, right, hopefully I've written down all those points and I will do my best to come back on those. So starting off with GP scrutiny. So primary care is a very interesting entity. So it's commissioned jointly by the CCG and NHS England, and I sit on the Primary Care Commissioning Committee, which is a joint committee between those two organisations. Those meetings are public, and I would recommend that people, that you could read those papers to, see at least what some of the issues are. And I think it might be something that maybe the CCG Health Watch liaison meeting could look at, actually. So I'd be very happy to feed in some intelligence into that. Hopefully that covers that one. The vaccination programme. So if we're lagging behind on the numbers, we go by what people tell us. So what people tell us is that they're very happy with the way that vaccination's going. So if you've had statistics this morning that say that we're behind, then that's kind of like the targets that are set for the providers from government, but actually local people here in Cambridgeshire are really actually quite pleased with the way that vaccinations have gone, and that we've picked up those odd issues around housebound that I mentioned, housebound people. We've also worked to get to sort of to people whose first language isn't English, people that are homeless, and the CCG, I do believe, has got a bus that is going out, and there's been some pop-up clinics. So it's what people tell us. So what people tell us and what the data says is very often two different things. So that's why I'm saying that, because we present what people tell us. We don't represent local people. We present what people tell us. So more NHS dentistry. Oh my goodness, yes. So magic wands, love it. So it's a national issue. So Health Watch England recently published a report saying NHS dentistry a national crisis ? And we have had our report to our last board. The chair of the local dental committee was very candid. They have got some plans of the ways that they're trying to run the contract differently, but I think there's no two ways about it. They've got a huge challenge. There are some plans in place, though, to change the different roles of dentistry so that there's more basic dentistry done by a different profession. So I think they have got some transformational ideas, but I think they're a little bit embryonic at the moment. But I mean, I'd like to hear more from those things in particular when they come back to you in September. I'd like to know that too. Leaving hospital, transport, yes, anything you can do, please. So the transport issue's always been a problem. There is a non-emergency patient transport service that's commissioned by the CCG. That's just the contract of that's just being extended. Basically, there does seem to be, well, we're told there is too much demand for the amount of commissioned work. So there's a mismatch between what is commissioned and what the demand is, and the logistics of conveying people home, sometimes to other counties as well, because we do have two specialist sites in Cambridgeshire, and there are issues about getting people back into other CCG areas, repatriated as well. Anything that the local authority can do around community transport, I do know where I live, particularly in my village, has got a fabulous community transport service, and if only we had a comprehensive patchwork of community transport, I think that would be really, really helpful, actually. So, yeah, I'll pop a plea in there for that, please. So, our intractable problems, goodness me. So I think, well, dentistry is an intractable problem. I think the workforce is an issue, absolutely, in the east of England. generally. I think we have amongst, I think you'll probably have heard this from lots of colleagues about how difficult it is to get people, and there is a risk that one organisation, one provider poaches staff from another because they can pay a few more thousand a year and offer probably better conditions. So to me, the availability of qualified staff is also an intractable problem. I think that so I don't think it's an intractable problem, but I think it's one that could be solved, and this is a little bit of my soapbox. It's about more self-care and more self-management information. So I think if we can empower people more to look after their own health and give them the information they need to manage their own long-term conditions and keep everybody healthier, and then decisions are made together with them. Recently, it was last week, NICE have published shared decision-making guidelines, which I am actually really excited about, and we submitted some feedback to the consultation on developing those guidelines. And I think if there's one big ticket win from a Health Watch perspective for the whole system, I think it is getting more people empowered to look after their own care and better self-management. And getting everybody to work together on that as well would be great. So we haven't actually got any plans to repeat the COVID survey, but thank you for the feedback that it's helpful and interesting. It is something that we are planning our work programme for the next year now, and it is something that maybe I think we could go back and take stock of certain areas, so just focusing on a few points, I think that would be helpful. So at some point when we start looking at the end of 21-22, I think there is something about us going back and touching base on some of those particular issues. Yeah. So the positive change during the pandemic has been around telephone consultations. Personally, I think they're amazing. I love it if my GP rings me. I can sit there working and just take the call whenever it comes. And I've said this quite a lot to people working in the system. If we can get everybody that can and is appropriate to have a telephone consultation, let's get everybody doing that. If we can get everybody that is appropriate and they're able to do online consultations, let's do that. And then would there be more capacity for everybody then to have the face-to-face for those that need it and can't do the other two? So I think there is something about the consistency of triaging and the ability of what is quite a fragmented system to work to that sort of standard and everybody to have the same understanding. But I think that has been really positive change, as has the providers and the CCG have always been willing to listen to patient experience, but I think in the past year they've been even more willing, because before the pandemic, professionals, dare I say this, thought they knew what patients wanted and experienced, and then the pandemic happened and they absolutely knew they didn't know what the public and the patients experienced, and they did look to us. And it's been really a positive experience during the past year about how our feedback has been received, and some of the changes that we've managed to influence. Border issues are, maybe I should have added that to the intractable problems actually. So again, it's system. So I don't think there is any reason why the system can't work across a border. It is difficult, those people where GP practices and local authority boundaries are not coterminous. It is a problem, and it works both ways. I mean, we've got a really good reciprocal arrangements with our neighbouring Health Watch all around our borders, and that works really well. I think the CCG could probably get better at keeping a tab on that and making sure that the person doesn't get caught in the middle. So that's what worries me a lot of the time, is with the intractable problems. Maybe we should add continuing healthcare to that, and is that people get caught in the middle of kind of like who should be picking this up, and people go, well, it should be you, no, it should be you, and then the person's caught in the middle. So I think the border issue is where that does happen. So, but I don't know that it's intractable. I think there could be a solution if there was better cross CCG working. The provider collaboratives and the ICS, I could answer those together. So the reason why I'm keen on the ICS is because of that very word collaborative. So it means that everybody's got to work together, and if we're saying everybody's got to work together, as far as I can see, then patients and public should have an equal voice in that everybody, and they shouldn't be, patient experience shouldn't be a tag on afterwards. It should be something, engagement with the public, it should be done up front. And it is hard to explain to people what an integrated care system is, because people don't really care what the system is. They just want to make sure they get a GP appointment or a dentist, or they get their medication, or they get their hospital or their x-ray appointment whenever they want it, you know, or whether when it can be given to them at a suitable time. So I think there's an opportunity for us to think about how we explain that to the public. And I have sometimes said that one of the jobs at Healthwatch is to explain that to the public, and hopefully you've seen all of our language is simple, and it does feel sometimes that we're trying to explain the unexplainable. It is so ridiculously complicated. So I'm hopeful that the ICS is going to simplify things, and having commissioners and providers sitting in one room, open and transparent conversations informed by patient experience has got to be better, I think, than some of the more closed room discussions that might have gone on about contracts in the past. That's why I'm hopeful. I think hopefully I've just explained myself okay there. So national regional comparison and where we're lagging behind. It's really hard because everywhere is so different. So not only within Cambridgeshire is everywhere so different, but regionally everywhere is so different, nationally everywhere is so different. So I would say it's quite hard to make a comparison. I mean, everywhere's suffering from the same issues around NHS dentistry, and all areas have the same fragmentation. I wouldn't say, when I talk to my Healthwatch colleagues, I wouldn't say that Cambridgeshire is any further behind. Maybe we could make more of the innovation and the wealth of experience that we've got in the south of the county. I'm not sure. I think with health inequalities, maybe that could filter out a little bit better. And some of the deprivation that we see and the consequences of that in Fenland and the consequences for health inequality. So I think, going back to the border issue, I think people, particularly that live around Wisbech, have a pretty short straw because they're a long way from Cambridge. They look to the Queen Elizabeth Hospital in King's Lynn, which is kind of has been on the CQC radar off and on for quite a while, and there's transport difficulties, and they kind of like get caught in the middle of that fragmentation, and I think in that area with the unemployment issues, and I just think generally people in Fenland get a bit of a raw deal. So if I would say if anywhere we're lagging behind, it might be sort of like around some of our rural isolations, and maybe kind of like East Cambs as well, and those parts of our county that are rurally isolated, and suffering as well digitally excluded because they haven't got terribly good connections. So when you're wanting to do an online consultation, if you haven't got very good broadband in your house and you haven't got a good mobile signal, you're a bit stuck. So I think some of those health inequalities around rural isolation and digital exclusion, I think we might be lagging behind on. Have I answered the questions okay?
You've answered them brilliantly. Did anyone not get an answer that they wanted? Look at that. You've got 10 out of 10 for that. And you know, this is the first meeting. We're absolutely delighted that you're with us at our very first meeting of the new County Council, and you've given us a lot of good information there and a good ideas for further thought, and we'll be meeting on a regular basis, and we very much value what you and all behind you is a whole infrastructure, isn't it, for you to do all those consultations. So to your team and to all of that, the people that take part in that infrastructure, you know, please send the very best wishes and thanks of the County Council and our enthusiasm about partnership in the way that we've expressed. So.
Great, thank you very much, and I'd like to say thank you to all the people that give us feedback, because we couldn't actually do it if people didn't tell us anything.
Excellent point. We've got only one other substantive item for this afternoon, which is about our training development to help us to undertake this task. Kate again, item 19.
Thank you. So I've actually put together for you a proposed work programme. Hopefully what you can see in front of you is...
Could you speak a little more closely into your microphone, please?
Yes, of course, sorry. So I've put a proposed work programme for you, and what you'll see is the blue sections are actually when you've got meetings, and there's a suggested scrutiny agenda for those meetings. These are all suggestions. And then in between, I've put for proposals for development sessions or liaison meetings, so that you can see where the liaison meetings are scheduled in, or if we want some workshops. So as I say, this stands very much as a draft for you to kind of help me and inform me as to what you would like to see over the course of the next year.
And Susan might comment, or anyone else, but what I was informed is that it was quite useful where we were choosing to undertake scrutiny, that we had a development session on that topic first, just to get basically up to speed with the basic information, and then that enabled there to be much better questioning and understanding when it got to the actual scrutiny meeting. So I think that's correct to say.
I don't think we have a development session for every scrutiny item, but if I may be bold and return to the quarterly liaison meetings, I would really, if you're interested in scrutinizing something, anything, have a go with those, join that, because that's where the really interesting learning for us is, and that inspires scrutiny, and that is actually a form of development. That's a form of learning. So that's what they're for. So that's a plug.
Okay. So having said that, can we go back to the report? So this is page 255, page 255 and 256. Are there any specific issues or suggestions about what Kate has written for us on that? Or anything else? If there's a particular aspect of the health service that you would like some training stroke development in, and that would be good for your interest and our collective interest, this is the moment to put it. Yes, Councillor Hay, thank you.
Thank you, Chair. Can I say now, I brought up this morning about dental services, because at the time, if we can go back to this morning's agenda item 16, I see it's headed up Adults and Health Policy and Service Committee Agenda Plan. So I expected to see not only things that refer to adults, but also items that refer to health within that one agenda plan. And I find it very confusing when I'm looking at what's on an agenda to have to, first of all, look at item 16 and then go right to the end to item 19 to actually see what else is on the agenda. Going forward, can we not just have one agenda? After all, the administration's argument was that health and adults should be merged. They're either merged or they are, as we seem to be having now, having an adults committee in the morning and a health committee in the afternoon with everything kept apart.
Thank you. The answer is yes in terms of the agenda plan. That's definitely the intention. And you're right to say what you say, so there's no doubt about that. The reason that we've put a separate training and development plan in the afternoon is that in the afternoon sessions, the district members join us. So they have to have an opportunity also to suggest and help agree any training or development opportunities that we have. Your wider point about doing scrutiny in the afternoon, I think we could debate that, but I think perhaps we've debated the committee structures enough. It was said already at the annual meeting that this is what we would do and why, because the scrutiny function is a distinct function and one that involves us with our district colleagues. We obviously could do that in the morning and then have other items in the afternoon, but it seems sensible from the point of view of our district colleagues that they know they can come at a particular time and it's more time convenience to them. It's nothing other than that. But your earlier point about the agenda planning is absolutely right, and I do assure you that's the intention. Any other comments on the 255 to 258? No? Well, I can only really emphasise what Councillor van der Ven has said. If we want health to be a priority and we say we want it to be a priority, we have to participate and we have to take part in the meetings and we have to contribute in the debate. So it's been a little quiet this afternoon, but we're all new, or many of us are new, and so there's no implicit criticism in that. But I hope for next time that we'll have a burgeoning, bubbling, enthusiastic set of contributions, as we did this morning, is my memory. I think we did do that this morning, so I hope that we'll do that in the health scrutiny section this afternoon. Sorry, there's a hand, and the hand is from Councillor Daunton.
Thank you, Chairman. So taking up Councillor van der Ven's point about the liaison meetings, would it be possible to have dates of all of the liaison meetings so that even if we hadn't specifically signed up for them, if we did have a moment to join them, that would be helpful?
That's a helpful suggestion. Kate, how are the dates? I don't know. How are the dates set for those?
We've set them with the trusts already, and they're in that first paper. So all the dates are available in that first paper of the liaison meeting.
Okay, so could I just follow that up, Chairman, please? So would it be then possible to learn how we join them, whether they're Zoom or Teams, and have those addresses, have those links?
So following Councillor van der Ven's suggestion that I go back to all the trusts and say that, and confirm that we'll actually continue with our, I think they're a combination of Teams and Zooms. What I'll do after today's meeting, now that I've actually got names of people that will be kind of appointed to those liaison meetings, you'll actually start receiving calendar invitations, and that will have the appointment on the calendar invitations. If you wanted to join, given that you can all see the dates that they're happening, if you want to pop into one of the liaison meetings after this meeting, just drop me a line and I can make sure that an invitation goes to you if it's not one that you've put your name down for. Obviously you just said if you want to just go, if there's something interesting that is coming up, and we'll put forward. What we do is normally about 2 weeks before the meeting, I ask for agenda items from all the councillors, and then we also ask for the trust to put forward their agenda items. So you have an agenda before the meeting that's agreed.
Okay, happy with that? I think we are. Can I just give one final chance to any of the district representatives who's not spoken to, if you want to add anything, give us any feedback about this meeting, or any desire about how we organise it, anything that any of you wish to raise with us? No? Okay, well, you've all made a considerable effort to be here. Thank you very much for being that. Again, this is a start of a journey for all of us, and we really look forward to working with you in the months and years ahead. I informally have to read out that the recommendation on the report was to note and comment on the agenda plan and training plan, and indeed we've just done that. The final item is the date of next meeting, which is Wednesday the 22nd of September 2021. It's been my first meeting in the chair. I've enjoyed it thoroughly. I've very much been stimulated by all of the ideas and the discussion, and very impressed by the quality of work that's come forward from our officers. So thank you very much sincerely for all of your contributions to everyone in the room. And on saying that, I now bring this meeting to a close. Thank you.